We got your 6.
At 6 a.m. with The Link on Breeze 93.9 FM. Bree and I connect you with all the latest news and information you need to know to start your day.
Then check back with Guam's news leader at 6 p.m. for the day's top headlines with KUAM News Primetime.
From 6 a.m. to 6 p.m. and everything else in between with KUAM Digital, we got your 6.
Antes de nega Radzauds and malak estrezas durante todo el memu a nogi distancia como gupugi palu Zaniman malak guafi ikonuna sugi airi prebatu la noci nai banderata gaigi pues Atan Fanny Bandera Kau esta pagua pumalapa Giluk tanu man libri Sentami ti man ko badi
Tamoru purita nota kantai matu nanyagi todu ilugat para i honra para i gloria abiba is la sin para i honra para y gloria abiba is la sin parar todo y tiempo y paz para kita dan gini langit na bendition conchay peligro na fan sofuham Zeus protegis languahon conchay peligro na fan sofuham Zeus protegis languahon
Osaina, Oemiti, Ninumai
It's up to you what you wanna do in this lonely summer night. Just make sure that it's worth the while and that it feels alright. All good vibes. It's alright, everything will be okay. When the sunrise, dark turns to light. Even when nothing is going your way. When the sun sets, don't get upset. So won't you fly, It's up to you what you wanna do in this lonely summer night. Just make sure that it's worth the while and that it feels alright. All good vibes. So won't you
I just want to open by sending this one out to Zach St. Nicholas. 6:18. You ready? Let's go. Good morning, Guam. Good morning.
Off a day, everybody.
And rest in peace to the man, Zachy.
Yes.
Good kid. Really good kid. He was
Friend of the show for
Friend.
like a lot. You know, inspired so many people. Yeah. Such a good person.
Yeah.
Man, definitely condolences going out to his mom, his family. Actually went to Ross yesterday, got the news. We came back out of the truck and just had to throw up some prayers for Zach, who I mean, such an inspiration and providing that example of dignity in his battle with cancer. And we all know somebody who's been touched by this disease. I hate cancer. Let me tell you, I would just freaking hate it so bad. But to know that he's not suffering anymore, and to know that he kind of lived with this positive vibe. I mean, you know what I mean? Even though he was fighting this disease.
I've known Zach since he was he attended St. Anthony's Catholic school. He went to school with my daughter. They were actually classmates, and they were really close. And so, you know, my condolences to Mindy, who used to actually work here.
Yeah.
And to
to
Tom,
Simon.
and I've known Zach's parents for 35 years and everything. You know, good people, good family. You know, to their grandparents. You know,
I know his mom, and I didn't really know much about him. I heard so much about him. Just
Talented.
talented people talking about what an example he was, and we see it with these people who get cancer. I mean, to live and to put it on display for everyone to see that you can make some good days when you're battling cancer. But that, when he came on the show and he had made that decision that he wasn't going to be going to chemo anymore and he was going to come home, I mean, he was just so positive, and the vibes we got from him the couple times he was on. I remember when he had graduated. It was just really, I mean,
from Colorado, very, very good school too. I mean, that is a major accomplishment. So,
yeah, it's just tough because this disease takes so many people, and the way he lived with it, I think it really just gave people an example of one way to fight cancer. And man, I saw his mom's post, and she put her angel gained his wings. So definitely, resting in peace, and he's got some good company up there in heaven.
Yeah, Mindy, we're praying for you all. We love you, Mindy. And actually, I want to add something because many people are putting in our comment stream too. Somebody else that succumbed to cancer today, someone who meant a lot. I did not know this person like I knew the Sinicos family and everything, but Eddie Van Halen has passed away. Also from cancer. He fought that disease like on multiple occasions for a very long time. And there's a lot of people who were like me, were inspired to pick up the guitar because of Eddie. Completely untouchable. The techniques, the innovation, everything that he did was, it's just so next level, just so creative. But, Eddie Van Halen no longer with us.
It's 6:20. This is the Link on the Breeze, 93.9. Good morning to our viewers on Facebook Live, and it looks like we got a few already. Josel writes, Hafaday, good morning, Guam. Greetings from the Philippines.
Rananim from Alaska.
Oh, nice.
Annie Della Pena writes, Hafaday from Tucson.
Hafaday to my mom and my brother streaming us from Las Vegas.
Josel Pring II says, Hafaday and good morning, Guam from the Philippines.
Chuck writes, Hafaday from Bremerton, Washington.
Oh, nice.
Hafaday Chuck Gautier from Bremerton, Washington.
Right, Vicente Blas Tyrant.
Did you just say that?
I did just say it. That's
What
all
did you say?
It's even better the second time.
What did you say?
I said Chuck writes Hafaday
Oh,
from Bremerton.
Chuck. Okay, I guess because I didn't hear
Third
it
time's the
last time.
charm. Jay, you want to read Chuck's?
Bremerton, Washington. Shout out to you guys. You guys got love from Guam, man.
As you can tell, I barely listened to Chris.
Yeah, I know. She tuned me out
Or
already.
me too, because yesterday a lot of the ones that I read, you read
What was
like
that,
4 or 5
Jay?
of the
Did you
ones
say
that I
something? Vicente Blas Tyrant. Mananas y Duas Todos Hamzu. Joey Frunk is Buenas Todo. Who we got? Else we got here?
Melanie Untalan from EPAL Beach, where the sun is trying to rise.
All right. Well, we do have a shout out. We've got a lot of Chamorros, a lot of friends on the show joining us from all over Texas. We have never had El Paso, but El Paso is checking right now. Jesse John Sanchez. Hafaday to you.
Christina Olgon Hokug Hafaday. Good morning, everyone watching from Manilao.
Hello, Gabriel Alcantara from San Diego, California.
Burn Flores writes, good morning from Inalahan.
JP Kanata says, Hafaday from the 82nd Airborne Division. You can tell when you're an 82nd Airborne, like a paratrooper. They train at Fort Bragg, North Carolina. That's the one that says AA, All American.
Hafaday Anna Tekenko Henry, watching from Silver Creek, New York.
Wow. Anita Materni Blas McHale writes, cancer sucks. I agree. I hate cancer with a passion. Emily writes, good morning from COVID quarantine facility in Tumon. Another glorious day to be alive on Guam. Be safe and well, everyone. It's like the most positive quarantine person we heard from.
You know what? And that's kind of in the spirit of Zach. Let's let's be positive. Let's not, let's inspire everybody.
Hey,
Let's-
how about our friend Joe at Tuna Guam Hafaday from Dedido? Joe, if
Hey, Joe.
if anything's cooking at this hour, we're here. I'm just saying, we can do a little curbside, reverse curbside. We'll come out to you.
Sazu is saying Hafaday all the way from Iowa, where it's kind of cold right now.
Thea Baza writes Hafaday from Astumbo Dedido. Astumbo for you.
Hey, Jesse Rosario, listening from the stoplight in Barragata.
I wonder if he's still at the stoplight. Which stoplight?
Wait,
Yeah.
which one?
It says in Barragata. Maybe, I don't know.
Don't be exact.
sign.
Someone might be following him.
Okay, Frank Bloss is saying Hafaday and good morning from Ipan, Talafofo.
There you go, Ipanese. Good morning to the south. Of course, Maleso, Umatic, Inalahan, Malolo, Talafofo, Jotnia, Pago Bay, Orda Chalampago. We're just trying to get everyone here. Sinanya, Ganya Heights, Petey, Agate, Santa Rita, Sumai, good morning.
From the Empire State, Silver Creek, New York is in the house. Hafaday to Anna Henry.
Hafaday to all our frontliners.
There you go, Hafaday to all of our backliners, too.
Okay, well, Bree and Chris and I were talking about this before the show. We said, remember the old Guam prefixes before? Mm-hmm. If you were from, Jigo, 653. Dedido, 632, 637.
Jotnia, 789.
Yeah, because I was like, what's Jotnia again? I forgot, but 565 Agate, 828 Maleso. What's Umatic? Is Umatic 828?
It was 828.
It's
It's 828 also, okay. But I think 477 is the one that covers the most, right? Because that's Barragata.
That would be
Manila.
like Agania, sometimes Orda Chalampago. There was also a 472.
Yeah, 472, 477. 646. And 647 also
735,
cover a lot.
Manila.
734, also Manila, Pago Bay.
Yeah.
Yeah, so basically when,
And that's
So-
old school.
this is really random, but when I think it was MCV Broadband Festival,
Oh,
when they
gosh.
when they started doing the home phone service, a lot of the numbers, those prefixes that you're talking about, changed from whatever they were, like 789 to like 969. And then it then became like you wouldn't know what village. This is all before cell phone, guys. When you ask for someone's number, they'd be like, "Oh, 969 something 11." You don't know.
Caller
but in
ID
the
is
olden
like the
days,
greatest thing, right?
yeah, in the olden days, if someone said 789, you'd be like, "Okay, they live in Jotnia or whatever."
Okay, well, we do. We always get love from Bardstown, Kentucky with our dear friend Debbie Davis. So, Debbie, we hope your wrist is feeling better. We know you're on the mend. Let us know how you're doing. But today we have a shout out from Jake Cruz, who is in Lexington, Kentucky. That's the home of the Wildcats. So,
Right.
Jake, are you at UK right now? If so,
The
stay
Bluegrass
safe.
State.
Yeah.
Henry writes off today from Dedido. Jun Linda Pangolina Buenas from Saipan.
Hafaday.
All right. Good morning. This is the link. It's brought to you by Carrier, where you can be cool. 647 cool. Okay. Also, Calvo Enterprises, IT&E, and the Thrive Coalition, where it takes a village to raise healthy and drug-free youth. Big show as always. We're going to talk to Dr. Hoa Wen, the Physicians Advisory Group, as the numbers continue to come in, the deaths continue to mount up. We're seeing positives, the positivity rate. If you Google Guam COVID stats to see where we rank nationally with our averages, it's pretty crazy. So we'll have Dr. Hoa on. We're also going to get the State Historic Preservation Officer, Pat Lujan. There was an oversight hearing yesterday. And so he'll come on to kind of unpack that. We got the GDOE Superintendent, John Fernandez. Even though we're getting high numbers, I know the conversation, and remember, what is it? Dr. Cabrera always says discussions are not decisions, but the conversation to get back to face-to-face learning is happening. That doesn't mean you're going to school tomorrow, okay?
Yeah,
Relax,
hold
okay?
up.
They're just talking about it because what do we get mad when they plan, we get mad when they don't plan, so let them plan. Also, Maria Pangolina, the Guam Election Commission, will come on. They're really trying to get people to go out and vote, and so we'll tell you, we actually did it. It was really easy.
The hard part was the temperature checks.
Yeah, I figured it out.
We have to share that side story, please.
These science fiction thermometers, I don't even think they're really, I think it's just a random number generator. I don't understand the science behind, like, why can't I put my forehead up to it? Why does it have to be my wrist? I don't know.
Everything's so fancy now, everybody's changing it up with how you take your temperature.
Okay,
Yeah.
as a
I draw
nerd,
the
but-
line on like my butt. Imagine
that's
if
the thing
they
that we-
came out with one like that. Did
you say
ridiculous?
what?
We're doing rectal checks. It's-
The temperature
yeah, Jay,
checks.
because,
I'm
back in the
like,
day, Jay, the thermometers, they only made two kinds. One that goes in your butt, one that goes in your mouth, and hopefully you never mix them up.
Yeah.
He's all like, what?
No,
Like,
well,
I only use the butt one.
It is more accurate and faster. I'm just saying, you know.
Down to the 20th of a degree.
If you are very, very ill and they say you're not averse to having your temperature taken rectally and everything like that, you will get a more accurate reading.
Let's just not get into how you would request that.
Okay, well, real quick, you know, we typically don't do the birthday shout-outs until much later. We do that in primetime, but we do have a special birthday shout-out for a very good friend of ours, someone we've known for a while, John Balbin.
All right, happy birthday.
So happy birthday, JJ. You know, an esteemed member of the Guam Police Department. You know, he's taken us out on the boat. You always, the nicest guy you're ever going to see, and he works in like high levels of security too. Yeah. So happy birthday, John.
Happy birthday.
There you go. Sorry, I just need a minute to... when we mentioned that rectal thermometer, Jason was just a little too excited. He's like, oh, childhood memories. Okay.
I volunteer as a tribute.
I volunteer as a tribute. Okay, guys, good morning. You know, last night I was trying to calculate how many days we've been in this lockdown because I want to come on every day and I want to be like, this is day 52 of the lockdown. Because it sounds like legit, right? Like, dun, dun, dun. I can't do the math with months. I know that it was declared on August 14th, so I'm thinking 51, 52 days. I'm going to figure it out.
I think it declared August 14th and then went into effect like the following day or the 16th or something.
All right.
Like that.
Yeah, so let's just say it's been a minute. So, yeah, all that coming up on the show. Remember, 9 o'clock, we're doing our KUAF News Decision 2020 candidate interviews. Your candidates this morning. We'll have Democrat candidate John Ananich and then Republican incumbent senator. She's the minority leader. Senator Tello Taitagui, and candidate on the Democrat side, former Chief of Police Fred Berdalio. That's what's happening on the link. Let's get right into it with a look at the day's headlines from the KUAM News team with the very latest. Good morning, Sabrina Salas-Matanani.
Off today, everybody. Good morning. We start with the latest numbers. Out of 651 samples, 65 returned positive for the coronavirus. Currently, there are 841 active cases with more than 1,900 recoveries. According to last night's Joint Information Center report, there were 40 hospitalizations at the Guam Memorial Hospital, with 14 COVID patients receiving ICU level of care. Additionally, according to the JIC, there are 2 hospitalizations at Naval Hospital. Meanwhile, another Guam Department of Education employee has tested positive for COVID. The confirmed case was identified through contact tracing and was from John F. Kennedy High School. President Trump said he learned a lot about the coronavirus as a result of his diagnosis, but his message to the country continues to be it's not that bad, as he works to project an image that he's beaten the virus. Skylar Henry has more details from the White House.
He was able to just drink and
The White House doctor says President Trump is reporting he has no coronavirus symptoms today, but that does not mean the president is COVID-free.
We know that first week people can have symptoms that can be serious, but they may be relatively milder than the second week when you suddenly get inflammation, this inflammatory phase, and that's where people can really very quickly go south.
CBS News has learned administration officials are looking at options for the president to address the nation as early as today. The White House is a coronavirus hotspot, with at least 18 infections among staff and recent guests.
We have to assume that the president still is contagious, that he's shedding virus. You're not considered free of the ability to infect somebody else for about 10 days after you develop symptoms.
President Trump will continue coronavirus treatments at the White House, and his doctors say he's not out of the woods yet. The president's team has not shared some key details about his condition. In a new poll from Axios, 23% of those surveyed say the president being COVID positive makes them less likely to trust him to provide accurate coronavirus information. 17% say it makes them more likely to trust the president. Skylar Henry, CBS News, the White House.
And that was Skylar. Now here's Tyler.
Hafaday, good morning, everyone. I'm Tyler Matanani with your headlines here on The Link. Inhumane and unnecessary. That's how Jaylene Cruz describes the policy that is stopping her from being by her husband's side as he faces life-changing surgery at the Guam Regional Medical City. Nestor Lecanto reports.
His greatest fear is he's worrying about dying alone.
Galen Cruz's husband has been hospitalized for more than a week. He's been calling daily, crying for help. the pain hard to bear. For the last 20 years, Gayleen has been his caregiver, never leaves his side, always there for him, except now.
The last thing the patient should be doing is worrying about being alone. They should be worrying about getting better.
She says GRMC needs to change its caregiver policy, even in this time of COVID.
In the United States, there are many hospitals that are allowing caregivers, not visitors. I understand, not visitors because of COVID-19, but I think they're being a little over paranoid. You know, the virus has been here since January. It's going to be here. Are we going to keep locking our caregivers out from our loved ones? Are we going to keep separating them? There has to be doctors out there for the doctor advisory board who can put their heads together, and the senators and everybody have a little compassion. Families should not be going through this. It's unnecessary.
Her husband's health has deteriorated. He's now dealing with the devastating news that he faces amputation. In his most vulnerable moment, he needs the one person who has always been there for him. Desperate, Gayleen has reached out to everyone she could think of for help. The hospital, senators, the governor, and now the media.
Time is running out for me. My husband has a major surgery on Thursday that's going to change his life forever. And I need to be with him.
For Guam's News Network, I'm Nestor Lecanto.
We reached out to GRMC for comment, but are still waiting on a response. We told you their story Monday. 3 sisters stuck in a GovGuam quarantine facility pleading with the government to expedite testing in order for them to home quarantine and mourn the loss of their sister with family. Despite their hardship exemption previously denied, late last night the sisters were released. DPHSS tells KUM on the link Tuesday morning that they worked with the family to find a solution which all parties agreed to. However, there still is confusion with the hardship exemption from quarantine protocols. Public Health Liaison Officer Bertha Tyrant explains the process for applying for the request.
Go to the government's quarantine facility. You would be sent transported directly to the QVAC from the airport. And after that, you will be assessed and screened by a team of public health professionals.
She adds, while requests may be made prior to arriving, the standard procedures require everyone to go to the QVAC for screening. The exemption requests are reviewed on a case-by-case basis.
Coming in for, as an example, a death of a family member, they would probably just need to submit like an obituary or some kind of supporting document like a death certificate. If they're coming in for another hardship, such as a family member who's in hospice care, what I would normally do is ask them to provide maybe some information on the name of the hospice.
You can view the full interview on our YouTube page. That's the news for now. We'll see you all tonight at 6 on Primetime.
Commerce announces it's holding a community rally on Wednesday, October 14th. It's for anyone who calls Guam home. According to the chamber release, it will start with a motorcade from GPO to Adaloop, starting with a show time of 8:30 a.m. and go time of 9. The chamber is then asking that you take a stand outside the Guam Congress building at 9:30. The community rally is in response to job losses, reduced work hours, business closures due to COVID that have significantly impacted our island community. Those whose livelihoods have been disrupted by the pandemic are not alone. The chamber press release states this peaceful community rally aims to be a show of solidarity among our residents for our island leaders to see how the virus has impacted our community and to inspire them to act on legislation that will rebuild our economy, as well as ensure that there are jobs for our people to return to. Again, this is scheduled for next Wednesday, October 14th. The Calvil's Insurance Automobile and Homeowners Insurance Department reopens today after one day of closure after close contacts to COVID positives were reported to the company Monday afternoon. All precautionary measures were taken and will be open for walk-in businesses starting today from 9 a.m. to 2 p.m. All customers must wear a mask. Negotiations are still not over in the agreement between Gov Guam and the Defense Department over construction at cultural sites on military property. State Historic Preservation Officer Patrick Lujan has stopped work at the fifth and largest firing range on Anderson's Northwest Field and has proposed certain amendments to the programmatic agreement. Lujan told senators during a oversight hearing yesterday that he has put together some mitigation items that the military was open to providing. The SHPO adding that in order for them to continue to work toward a well-established PA, he has granted an extension to December 30th. Senator Therese Terlahi, however, said that while she appreciated that a public hearing would be held before the amendments are final, she was concerned that Lujan was making a deal without getting more public input first. Lujan reassured her that community input has been included in the more than year-long negotiations, and further comments will be considered during the public hearing process. And finally, in-office voting continues at the Guam Election Commission offices in Hagåtña. You're urged to make an appointment by calling 477-9791. However, GEC will not turn voters away. If you are not currently registered to vote, you will be able to at the same time until Friday, October 23rd. Meanwhile, this Saturday, the GEC heads to Jigo, where in-office absentee voting will be conducted at FB Leon Guerrero Middle School from 9 a.m. to 4 p.m. You do not have to be from Jigo. You can be from any voting district. You're required to wear a mask, bring a photo ID, and bring a blue or black pen. We'll have more on the link right after the break.
GU Self-Storage, conveniently located near the Harmon McDonald's. We offer affordable rates, online payments, and auto bill pay for your convenience. Plus gate access daily from 6 a.m. to 9 p.m. Call us today at 648-7867 for more information.
Pepsi Guam Bottling, a local company. We produce your favorite products right here on island, like Pepsi, Mountain Dew, Hanum, Chamorro Punch, Tropical Ice, and more. We've invested millions into local production and will continue to upgrade our facilities and provide local jobs so you can truly buy local. Our long history of producing the freshest and best products will continue. This is our vision. Pepsi Guam Bottling.
Your generosity can change lives. Disasters won't stop during this global pandemic, so neither will we. The Guam chapter of the American Red Cross is calling on the continued support of the community to assist with their mission of providing disaster relief and recovery efforts, military family support, and life-saving training and certifications. In times of emergency, our support will not waver, and we pray that your support of our efforts will continue as well. We invite you to join us in commemorating our 20th annual signature fundraiser virtually this year by supporting the Red Ball in a Box. We will be delivering special red boxes, which include a 4-course dinner from Micronesian Chefs Association and wine to our patrons and sponsors. As a sponsor, your company and message will also be featured in a special television tribute to the Guam chapter of the American Red Cross. For sponsorship opportunities and more information, please call 688-0280 or visit our Instagram or Facebook page. Let's support our community. Though we're apart, we're still together in generosity and support.
Celebrate National Pizza Month with a Pepsi Pizza Report. Pepsi helps celebrate this tasty month with an easy way for you to win Pepsi and pizza. Post a photo of yourself enjoying your favorite Pepsi beverage to KUAM News, Uno Instagram, or Facebook pages to enter to win Pepsi and pizza from one of 10 pizza sponsors. Catch the Pepsi Pizza Report every Thursday on KUAM News The Link Morning Show and on the social media pages of KUAM News for reports, tastings, and everything pizza and Pepsi.
We all play a role in slowing the spread of COVID-19. We must continue to stay strong and practice everyday preventive actions to keep our island safe. Maintain a distance of 6 feet between yourself and others. Wear cloth face coverings in public settings. Wash your hands for at least 20 seconds. If soap and water are not readily available, use alcohol-based hand sanitizer that contains at least 60% alcohol. Clean and disinfect frequently used surfaces. Avoid touching your face. Stay home if you are sick. Help reduce the spread of COVID-19 by downloading the Guam COVID Alert app on the App Store or Google Play. Let's protect ourselves, our loved ones, and our communities. Prevention saves lives. For more information, please contact 311 or visit our website at dphss.guam.gov.
You're watching The Link with Chris and Sabrina on TV 11, but don't leave yet because we're coming up next on CBS This Morning.
We got your 6.
At 6 a.m. with The Link on Breeze 93.9 FM. Bree and I connect you with all the latest news and information you need to know to start your day.
Then check back with Guam's news leader at 6 p.m. for the day's top headlines with KUAM News Primetime.
From 6 a.m. to 6 p.m. and everything else in between with KUAM Digital, we got your 6.
That's my favorite part.
Yeah.
That ding, ding, ding. Honestly, I wonder if Eddie Van Halen played some more music, how he would have played it. It would have been some two-hand tapping thing, and
it would have been like something like that.
It would have been like Mariana's Homegrown and Eruption combined, which would have been incredible.
Yeah.
Okay, real quick, our friend Senator Jim Moylan said when we were giving out a birthday shout-outs he goes, today's also Hannah Cho's birthday, the Public Information Officer for Department of Labor. She does a great job getting the information out there, and that's a lot of information. So happy birthday, Hannah.
All right.
Happy birthday.
6:45. Let's head into the KUAM News Zoom room where he was in front of the legislature yesterday for an oversight hearing. Some big revelations coming out. State Historic Preservation Officer Pat Lujan joins us in the KUAM News Zoom room. Good morning, Pat.
Hi, Pat.
Hey, good morning, everybody. How are you?
We're doing pretty good. It's Wednesday.
It is what? Yeah, it's Wednesday.
Yeah, it is.
It's
Today is Wednesday, everybody. The 7th day of October, year of our Lord 2020 AD. Time of the COVID.
I'm just getting up and going.
That's it.
I even wake up at 3 on the weekends. So.
I did that last Saturday. I got up to go, and I was like, there's nowhere to go. Oh,
Yeah.
Saturday? Okay, good. I think we're all kind of going through that. Pat, so there was a big, I think one of the big takeaways was there another discovery up at the construction grounds at the firing range?
Yeah, so that's not a new discovery. That's the same thing that has happened that we found a couple of months ago. So we're just kind of wrapping up that case with 4 burials over at Camp Blas. And so we're actually finalizing the burial monument with our office with them. So that's the one that was discovered probably earlier in the year, sometime February.
So can you just unpack for us exactly what was discovered, 4 burials, and then what other info can you give us about that? Because it's pretty interesting.
Yeah, I mean, it's one was a full set burial with what was the first time discovered on Guam was a pottery placed on the area of the head. And, this had before only been discovered in Saipan twice, never on Guam. So this was the first time that this discovery has taken place. We went ahead and approved the removal of the pottery just to see if there are any skeletal remains underneath, and there were none. So, the theory of having a burial practice with the ancient Chamorro people, trying to relate that to the incidences over in Saipan, that's basically what we're waiting for the report now from the archaeological and the osteological reports that should be coming out in a month or so.
So that was the one burial. What about the other 3?
The other 3 is just within the same confines of that one. So they're kind of in the same area that we've already kind of covered up already for the protection of it, and then we're planning the burial monument on top of that.
Right. So, Pat, I mean, can we call these ancient Chamorro burial grounds? It kind of seems like it if there's 4.
In that area, yeah, it definitely, it's stated as such, and then they're still doing some construction up there. So, whatever they're doing, we're still monitoring them.
I know that you had called for that 45-day pause. Can you just bring us up to speed on where that is and where the discussions are and all the mitigation efforts?
Sure. Yeah. So about a month or two ago, I invoked the stipulation 13. This one is up at Northwest Field on the live firing ranges, the 5th and final one, the largest one. So we've been in communication with them, basically changing the methodologies, requiring another resurvey of the property. And so far they've agreed to all of our requests. And so right now we're just kind of finalizing, fine-tuning the language of the agreement. But John Mark Joseph, our state archaeologists, and their archaeologists on hand have really put in a lot of work into the mitigation and down to the fine details of shovel test pits and so forth.
It's kind of, I mean, maybe not to you, but it's just a little confusing because we're talking about 2 different areas, right? So the STIP 13, that's on the firing range, and then the burial grounds, that's on Camp Laws.
Correct.
Okay.
That's correct.
And so we have not invoked STIP 13 for the burial grounds.
No, it's different because pretty much the one on Camp Blas, they're wrapping up their construction there. I mean, they're probably almost 100% done with the earth moving that they're doing up there. Even though it's at a different location, we're still looking at this from a holistic standpoint, and what we're learning on one side, we're invoking on another side, just based off of previous surveys and what has been done and what have we learned from the constructions going on right now.
Can you tell us a little bit about these monuments that are supposed to be constructed? Are we talking about like statues, like little statues?
Yeah,
it's
all different. Mm-hmm. So the law changed back some time ago, over 20 years probably, of leaving the burials in place, right, and not extracting them from the ground. As you know, going back to the 1920s, 1930s, and the famous Hornbostel collection, which still remains in boxes as of today. We're still trying to reinter them through the NAFTA and Maninata project. But since then, the whole objective is to leave them alone, leave them in place, and if they had to absolutely be removed, that they get reburied somewhere as close as possible to where they have been found. So you have different types of reburial monuments. You see one, I think one of the most famous ones is down at the Nico Hotel where the laddie sets are there. That's a reburial monument. You have one at the corner of Fiesta Resort. You have one down at the when they were building the new dump down in Talafofo. And there's still a lot that we're working to reinter, whether it's from a federal highway project down at Elig Bridge that we have to do that one. And so all of them are unique and designed specifically to that area and to the people of that area. In this case, it's going to be the same way. They proposed a monument, nice solid monument that's going to have signage in both Chamorro and English to depict what was found there, and to try to describe as best as possible the type of living environment in that area.
Is this going to be accessible to the community, to the public?
I think there is. I mean, every base has a visitors program, and I don't know the details yet, but I'm sure that they have one in place for Camp Blas once they open up. Because I believe their ribbon cutting for that is in spring, March, April timeframe.
Right.
Pat, going back to this Taiula, the full set of remains with the pottery on the head, you said that this was highly significant because it's only been discovered in Saipan, right? So I'm just wondering the process of studying these remains and, gleaning all the information that we can from it so that, the future generations can better understand and, even everyone living today can better understand how our ancestors, lived and died. How involved is your office and the local government going to be in the investigation into these remains?
So basically, we kind of dictate how far the study is going to go, because it could go as far as, full removal and full study, with DNA extractions, with a, world-class lab. But I guess the movement and the feeling of our local people is to keep them in place. Don't bother them, So we didn't extract anything other than the pottery, just to see if there's any skeletal remains underneath the pottery. Other than that, all the studies have been done in place. They didn't remove any of the skeletal remains. So they did the measurements. They had the osteologists go out there and do as much field work, study as best they can to come up with as much information as they can before we cover it up. Because even in those senses, you can't expose that for too long before they start to really deteriorate. Right. So covering up with soil and moist soil, that's the best thing to do, and just kind of, rebury them.
We did have a question from one of our viewers, and they're asking what can be done to improve existing reburial monuments. A tiny monument in front of Hyatt is almost insulting.
Okay, that's a good point. And, those are, under the responsibility of the owners. In this case, it will be Hyatt. So we can look into that and see how their maintenance program is.
Nice. Pat, just PCOR 1 lockdown. I know you guys are out there with the buildup in the military, but what about the other parts of you guys' operation? How's it operating under this PCOR 1 lockdown?
For our office?
Yeah,
Yeah. We're open, but we're only allowing one customer at a time. So that's for permitting processes, document drop-offs. All our meetings have been through teleconference or Zoom. Still trying to keep the social distancing. So, but yes, we are open. I want to say as usual, but we only allow one customer in at a time.
Could you kind of just take us just briefly through the process, say if there's a contractor that's doing work, and I'm not talking about on base, but just out in the community, and they feel as though they've discovered, an ancient artifact or unearthed something. What are they supposed to do?
So they're supposed to stop. This is standard with any construction company, any of the permits that. Basically, they have to, first off, before they do any work, they have to get our approval, right, as part of the permitting process. Mm-hmm. We take a look at the property. We see if it was surveyed before. If not, then, they basically have to get a survey through an archaeologist. And if it was surveyed before, kind of have an idea what is on the property and what to look out for, but still have monitoring involved. So we understand it's not a cheap endeavor when you do any type of earth moving on Guam, but that's really us protecting what is left, on our land and our history. So we hope that contractors and companies understand, that we're not trying to make things any more difficult than it is, but really, and we're seeing it, right, whether it's in base or out of base. We're looking at some other areas that on GWA projects and some private projects that they're coming up with artifacts and human remains. And so it's very, very sensitive issue that we take seriously. And, we just hope that people do the same thing. If they come across something, just stop and let us know. Our website is historicguam.net. There's a place there you can leave comment and it'll get to us and we can get back to you. And just, it is definitely a community watch, just like everything else on island. Mm-hmm. And we hope that people work with us And we're now taking the stance of working with others to make sure that, what is the right thing to do and for our history, for our children. A lot of people say, hey, it's not for my kids, it's for my kids' kids, so they can learn and understand the history of our island. So remember, the historic preservation efforts it's still fairly new. The federal side didn't start until 1960s. The enforcement on Guam probably in the 80s or 90s. And there was so much destruction and whatnot prior to that, right? World War II did a lot of destruction on Guam. So whatever is left remaining here, we'd like to learn more, as we are right now, with the burials up at Camp Blas. It's pretty much rewriting our Guam history with the Northern Plateau of the idea previously of it not being a settlement. Now we're finding out that there were settlements up north.
And I just real quickly wanted to follow up on what you mentioned about the Hyatt situation, the monument there. Is it up to each private business that has a monument on their property to maintain it? And then if that's the case, who monitors it to ensure that they are maintained? Or is it just you build it and then that's it?
Yeah, it's on their property, so it's their responsibility for the maintenance.
I see.
But we'll definitely take a look at that Hyatt one. It differs from, and I think I know what they're saying. It's kind of in my mind how it looks, so I might have to go swing by today and take a look at it myself.
But for any reburial monument, though, it's if the private company builds it, nobody from like the SHPO office goes out to just ensure that it's maintained. It's just, you know what I mean? If we're supposed to be honoring,
I guess in the past, it hasn't really been an issue for us. So this is the first I've heard. Normally, when we talk about, NICO's probably when we deal with reburial monuments, we use the NICO one as an example, and that's always maintained. And so do we go around looking and inspecting and monitoring reburial monuments? The answer is no. We trust that these private businesses are maintaining it. We're looking at active projects. But if it's something that becomes more serious, then obviously we'll take a look at it and start monitoring it more.
All right. Well, thanks, Pat.
Yeah, Pat.
For coming on.
Thank you.
I appreciate it, guys. Anytime.
Yeah.
All right. Take care.
Wash your hands.
Okay, take care.
Okay.
I will.
All right. Hey, Dad, listen to my message about Zach Banner. All right. 7 a.m. We're KUAM FM in Agana, Guam. We'll keep it in the KUAM News Zoom room where sanitizing duendes are wiping everything down with scented wipes this morning, antibacterial wipes. And we bring on from Catholic Social Services, she's the head there, Diana Calvo. Good morning, Diana.
Good morning.
Good morning. Can you hear me?
We can hear you. You're coming in fine. Good morning. How are you this morning?
Fine.
We wanted to bring you on, obviously, to talk about this, the homeless shelter. And there was I know that in talking with Mike, who runs the shelter up there have been some people who have had a hard time adhering to the different shelter rules and have been kicked out. And the most recent one that we had heard about was David Castro, who I understand was, I don't know, is the right word, evicted, Diana, or kicked out? I want to use the right terminology here.
Well, I can't really say much about the client related issues. What I can say is that the evictions from the shelter is not is a last resort action. So on the last interview, I said I reported that, we do have shelter rules, and it's primarily rules to maintain safety of all the individuals, including the employees. And if there are certain infractions, if you will, the staff will work with the individual units. But if it escalates or it endangers the safety of not only household members and employees, but also other individuals that might be in the surrounding, then we will take the strongest action, which is to evict the individual.
Right.
Can you provide us information on just how many people have been evicted to date? Or
So since we opened the dorm in June, at the latter part of June, there has been probably 5 evictions current.
is that like 5 families?
So the evictions have been on the individual who committed the incident, but for at least 2 of the cases, the whole unit, the whole family decided to exit the shelter. And, the reasons on those evictions, 2 or 3 of them involved domestic incidences that were physical. We had one individual who, right when PCOR 1 was announced, he breached the compliance and said they were going to go to a site where we know that there were some COVID positive. It was related to a COVID positive death, and they would have had to quarantine if they were to come back, and he didn't agree to that, so the whole unit left. We had a couple that were evicted and eventually were arrested, one for damaging property, and it was actually a follow-up to a domestic incident.
Diana, so because I spoke with David yesterday, and if you guys had followed us, Link on Location, we went over to the Global Dorm. We interviewed Mike Suzuki, who's running the place. We interviewed some of the clients. We interviewed David Castro, who at the time was being housed at the homeless shelter with his wife and their young son. Now, I spoke with David yesterday, and he's not at the shelter anymore. But the concern I had, and I know this has been reported, was the boy, the son, right? So when you guys have to do something like evict someone from the shelter, what considerations are given, and do you kind of mobilize any agencies that may have oversight over, for example, I mean, you're evicting someone with a child and they're going to be out on the street. So at what point do we involve the regulatory agencies like, I don't know, CPS, and because I know that's got to be a tough decision for you guys, right?
Yes, and so from the initial incidences and observations of our staff, including our social worker, if there are concerns about the welfare of children, then we will make a referral to CPS, and we have made referrals to CPS. And unfortunately, there's 2 things that don't happen concurrently or one affecting the other. And that is that when we make a CPS referral, we don't control whether or not CPS determines that referral to warrant an intake or an investigation. And if we have to take the drastic measure of evicting a family, then, they bring their kids with them, and that's noted. We've had other issues, even with homeless families, where for all of these, we do make referrals to Child Welfare Services because it has to do with parents supporting their children and also placing them in a safe environment. And homelessness, whether you're at a shelter or on the street will automatically warrant at least members of the coalition to send in a referral to child welfare services so they can ensure that the safety of that child is not being affected. And unfortunately, Chris, sometimes parents are not also being responsible about their own actions. And maybe they are, but that's kind of like the consequence. And we have said that, we don't have authority to hold a child. So if the parents are not being parentally responsible, we don't have the authority to hold on to the child until CPS gets involved or we find other family members.
Diana, have you guys had any?
And it was on media that on the very first day when Global Dorm opened, that household was one of the first families to move into the dorm.
Right. Yeah.
So he's been there almost. They've been there about 5 months.
Diana, have you guys had any issues at the Global Dorm with mental health issues or even substance abuse problems? And if so, how did you deal with that?
Yes, and so there's two approaches. When a person, there's no drinking or use of alcohol or drugs or smoking in the dorm. We're not necessarily restricting that. They do those things outside. But if they were to come in drunk, we actually don't admit them. They're not evicted, but they're just not admitted to the door into the complex, and so they can sleep it off outside, and that will minimize any kind of escalation of disagreements just because the individual is intoxicated.
Right.
We have had individuals observe to probably be depressed. We're not clinicians, but we do have new moms, and the staff has observed the mom not handling the infant appropriately. We have made referral, and we also recommended to the unit, to seek other services to help them. But it's also upon the acceptance of those individuals to want to receive the service. And so, yes, we have had incidences involving episodes, just I think last week we did call the GPD to come in to help control someone. And they exited the building and were causing other distractions to the neighboring areas, and that individual eventually was arrested.
Are you aware of any other shelters that are going to be open? Because, I mean, we certainly appreciate everything you guys are doing and the OHAP and everybody else, but we're talking about only one shelter that has opened during this pandemic, and there are still hundreds more homeless people out on the streets.
Well, I think that the governor's office and the departments, they particularly with GSA, probably they're involved still in identifying or even negotiating with other landlords to expand the availability of individual units. But I don't have a sense of what the status is on that. What I do know is that most of the individuals that we're seeing even now on the street are new faces. And they're not necessarily some of the individuals that we have surveyed this year during our point in time count or in previous years. And so if these are new homeless, that could be an effect of being unemployed because of what's happening, and then eventually leave, or because there is an eviction moratorium. But these individuals are new to us within the homeless community, and so most of the individuals that are at Global Dorm are unemployed. We actually do have several that are working, and so they are leaving to go to their jobs and coming back. But we do also have individuals that have been long-term unemployed. And so those that have been long-term unemployed have really not worked for 5 years or more. So the individuals that are coming in would have the greatest need, yes, for housing, but they have the most barriers also. And unfortunately, the ones that may qualify for some kind of GURA housing, those are already in progress. But for those that have the greatest barriers, the stay will be quite longer as compared to other household units.
Diana, I know you don't have any stats on the new homeless, right? But do you have any idea about how bad it is? Because I know out here in the intersection, there's a guy who was a hotel worker.
Yeah, he's new.
And he's new, and we're seeing. I mean, I know it's anecdotal, but at some of the intersections, I'm seeing new people who are asking for money. So, do you guys have any idea how bad it is with the new homeless?
Well, the challenge that we have with based on some of our intake is that some of the younger homeless are also coping with the use of alcohol, and even at the dorm, we have observed individuals that appear to be under the influence. And so, if they're not belligerent, if they're not acting out or causing problems, they're pretty much left alone. But for the most part, particularly those who come in intoxicated, they're not good drunks, if you will. And, we can't afford to have any kind of interaction that will lead to an altercation. And then, we have a mixed census of adults and children. And so that can be done outside. And, we will call the cops if we need to in order to bring control, but we will not accept them in. I also want to point out that, if someone is not allowed in, it doesn't mean they're evicted. They can come back in when they're sober or when they've calmed down.
Right.
And even for those that have been evicted, they have the opportunity to reapply for readmission back into the dorm. They just have to go on the wait list.
Right. How long's the wait list?
Well, we are, if there's a unit that's available, we go down the list and we call people. And if they answer, then, they get admitted. If they don't answer during that day, we go to the next name on the list. And that's that process.
How many
I don't have an updated list.
Okay.
I don't have an updated count just because yesterday afternoon, staff were admitting people and there were also inquiries, so they didn't have time to update their list.
You think it's like over
But
50
from the previous
people?
week, I think we had, I think at minimum 15 households on the wait list.
Households. Diana, so you have a staff there 24 hours a day. You said a couple times that you've had to call the Guam Police Department. Is there any security there at the Global Dorm, like a security guard, anything? Do you guys need that? Do you feel like your staff is, they're not security guards, right? They're not referees, right? They're not bouncers.
No.
I mean, they play that. They probably do a lot of that. I mean, they do. We're telling us, but do you need that security?
There is no security at the facility. We do have some senior staff that we've placed at the dorm who have gone through crisis prevention and intervention training. It's really focused on de-escalating any potential issues. But if there are incidences what we then react is everybody is advised to stay in their rooms while a staff is calling GPD. And as with some of our other sites, you know, the precincts that's closest to us have been fairly responsive, you know, unless they're all out on calls and stuff like that.
Right. Okay, Diana. Thank you for coming on and kind of going into that. And the takeaways are we have more homeless, and these are new homeless that you guys have not seen in the system. And
That's correct.
There's a wait list. Last we heard 15 households, which means kids, not just individual people, are on that wait list trying to get into the global dorm. We've heard from the Lieutenant Governor that they're having problems finding another shelter site. So he's supposed to come on tomorrow. We'll catch up with him on that. But Diana, thank you for your time.
Thanks, Diana.
Anything
You're
in
welcome.
anything in closing you want to add? Can you? Sorry, I want to because it's holidays. Are you guys doing any drive? Any donations accepting?
Well, we're not initiating anything. Actually, the community has been very responsive, and I did want to acknowledge, you know, the community's assistance, including some of the companies, you know, both the wholesalers, I guess, and some of the retailers, you know, for the stock inventory that they have, which are not selling. They actually have been donating to us, and we've been passing those out, including to Global Dorm, where we've kind of set up a little pantry for the families there to have access to snacks and things like that. And, you know, I think that we really, you know, when some of the commercials come up and says we're all in this together, you know, we really need to help each other, because there's a lot of families out there that are experiencing really real hardship.
Yeah.
And, you know, we're focused on those right now that have either lost their housing, or, you know, the stress from living in with families has caused them to move out and they have nowhere to go. And, you know, those individuals who may not necessarily make the best kind of clients, but, you know, we try to work with them, and there's multiple things that we're doing. And so we do appreciate, though, the support not only for CSS, but specifically for Global Dorm, because we have had a number of families as well as organizations, you know, initiate a drive to meet some of the specific needs. And that has been helpful also.
Diana,
bring the stress down.
right. Before we...
Yeah, I just wanted to follow up on everything that you just said. How we're all in this together, and there are people really hurting out there. Do you think the government has done enough, or do you think the government needs to step up and help more?
Well, you know, being a retired GovGuam worker, when we've had periods of emergency disasters, you know, that was island-wide, the pandemic brings on, you know, really new challenges, because it's a kind of emergency we can't see, except when people start to get sick. And so there's so many layers of work that needs to be attended to. And I think at this point, just from talking with some of my former colleagues who are still in GovGuam, you know, we have staff who are pretty much exhausted. And we need to come up with a way to refresh, you know, those individuals and infuse a way to re-energize, just because they're remaining dedicated to doing the work. But, you know, if they don't get a relief just to take a break, there's going to be other impact, you know, to the responders, just because they're having to attend to so many things.
Right.
And, you know, I can't say I'm glad I'm not in government right now, because I can actually appreciate the kind of stress and all the multiple things they have to do. That's not only COVID, but they still have to administer their ongoing programs, and they have to kind of put a balance, on doing both. And if there are competing priorities, how do you identify what would be the higher priority?
Yeah. Diana, when we went out to a shelter, I know that they made a big thing about it wasn't just going to be a shelter. They were going to be offering different programs, Passport to Services, trying to guide some of these shelterees through employment opportunities, letting them avail of substance abuse treatment programs.
Wraparound services.
Wraparound services. Has that been happening, or has it been affected by the PCOR 1 lockdown that we're currently in?
Well, at the beginning of PCOR 1, there were some delays in accessing services, such as with alcohol and drug treatment, even on the initial intake, and we were still trying to do a lot of things over the phone, but sometimes you just need to have that face-to-face interaction for some of the treatment services. And we have been bringing up some of those challenges, at least to the Lieutenant Governor's office, and trying to work with those agencies that have closed, to the public, and what are some workarounds that can be put in place to help at least some of those that are greatest in need. And, that includes getting GovGuam IDs at Rev and Tax, trying to coordinate inspections for housing for those that were actually lucky to come into public housing or who do have Section 8 vouchers and are able to move into their own unit. Some of the delays are because those government agencies did not open to the public, and so we're not going out into the field. Now that services are resuming, even though they're by appointment, they're starting to move, but we need to catch up, because we've lost 1 or 2 months in some of the access to services, especially.
Wow. So we'll follow up with Lieutenant Governor on that. Diana, again, thank you for your time. I know you gave us a lot of it, and you got to start your day, so we definitely appreciate it.
Appreciate you and everybody over there at Catholic Social Services.
Yeah. On your way out, grab some of there's virtual malasadas and virtual empanada right there on the table if you want to grab it, okay?
Thank you. Have a good day.
Low to no calories. Okay, Esther. I think she's on a diet. 7:25. We'll take a short break. We're coming back with Dr. Ho Wen, the chairman of the Physicians Advisory Group, next, right here on The Link. It's The Breeze 93.9.
Pepsi Guam Bottling, a local company. We produce your favorite products right here on island, like Pepsi, Mountain Dew, Hanum, Chamorro Punch, Tropical Ice, and more. We've invested millions into local production and will continue to upgrade our facilities and provide local jobs so you can truly buy local. Our long history of producing the freshest and best products will continue. This is our vision. Pepsi Guam Bottling.
Your generosity can change lives. Disasters won't stop during this global pandemic, so neither will we. The Guam chapter of the American Red Cross is calling on the continued support of the community to assist with their mission of providing disaster relief and recovery efforts, military family support, and life-saving training and certifications. In times of emergency, our support will not waver, and we pray that your support of our efforts will continue as well. We invite you to join us in commemorating our 20th annual signature fundraiser virtually this year by supporting the Red Ball in a Box. We will be delivering special red boxes, which include a 4-course dinner from Micronesian Chefs Association and wine to our patrons and sponsors. As a sponsor, your company and message will also be featured in a special television tribute to the Guam chapter of the American Red Cross. For sponsorship opportunities and more information, please call 688-0280 or visit our Instagram or Facebook page. Let's support our community. Though we're apart, we're still together in generosity and support.
GU Self-Storage, conveniently located near the Harmon McDonald's. We offer affordable rates, online payments, and auto bill pay for your convenience. Plus gate access daily from 6 a.m. to 9 p.m. Call us today at 648-7867 for more information.
Celebrate National Pizza Month with a Pepsi Pizza Report. Pepsi helps celebrate this tasty month with an easy way for you to win Pepsi and pizza. Post a photo of yourself enjoying your favorite Pepsi beverage to KUAM News, Uno Instagram, or Facebook pages to enter to win Pepsi and pizza from one of 10 pizza sponsors. Catch the Pepsi Pizza Report every Thursday on KUAM News The Link Morning Show and on the social media pages of KUAM News for reports, tastings, and everything pizza and Pepsi.
These are some of the signs that someone is thinking about suicide. Talking about wanting to die, excessive guilt or shame, and feeling like a burden to others. Feeling empty, hopeless, trapped, or having no reason to live. Feeling extremely sad, anxious, agitated, or full of rage with unbearable emotional or physical pain. Other signs include changing behavior, such as making a plan or researching ways to die, withdrawing from friends or saying goodbye, giving away important items or making a will, taking dangerous risks such as driving extremely fast, displaying extreme mood swings, eating or sleeping more or less, and using drugs or alcohol more often. If you or someone you know is showing these warning signs, get help as soon as possible. Call Guam Behavioral Health and Wellness Center's crisis hotline at 647-8833 or 4.
You're watching The Link with Chris and Sabrina on TV 11. Stick around because we're next on CBS This Morning.
We got your 6.
At 6 a.m. with The Link on Breeze 93.9 FM. Bree and I connect you with all the latest news and information you need to know to start your day.
Then check back with Guam's news leader at 6 p.m. for the day's top headlines with KUAM News Primetime.
From 6 a.m. to 6 p.m. and everything else in between with KUAM Digital, we got your 6.
Surrounded by my nature, no need to worry about these player haters and my culture. I got love for my people, still rapping Guam, staying true to my chat loops. Let me take you to an
island where the COVID keeps climbing. Hey! Let me take you to an island where the lockdown is a joke. Okay.
I'm representing Guam, USA. Raised on a hill in the Ville by the bay.
I think Dr. Ho would like that, huh, Doc? Remix! You guys don't want me to start writing songs again because you think your butt hurt now. 7:31, The Link on the Breeze. He's the chairman of the Physicians Advisory Group, Dr. Hoa Nguyen. Doc, let's just jump right into it. Kind of alarming, the number of positive tests, the deaths, the hospitalizations keep increasing. How serious is it, Doc?
Yeah, I'm not quite sure. You know, it's we're in a lockdown for 7 weeks or plus now, and the number really not going down. They kind of go down a little bit, and then it's going back up again. You know, it's the hospital get hit again. You know, as you can see now, I think the total COVID patient now, I think the last count 45. That's what I believe from yesterday. So it's going back up, and we expect it to continue to go back up slowly this week and next week if we do not slow down on the positive case. You know, I tell you, but it's we have to do a lot of things differently, look at different angle, just because, you know, I think that what we did in the past few weeks here is slowly fade away. So we have to approach things a little bit different. The family gathering, we see quite a bit of positive now come out of family gathering. You know, I'm not quite sure, but people still gather, you know, in the last 2-3 weeks or so, and they come in surprisingly that they turn positive. I have no idea, but and they realize they make a mistake, and that's the story we heard over and over again, is that we make a mistake of celebrate my mother birthday, whatever, and the whole family get together, and that's something that people realize that it only take one event and we're going backwards. So it's just really need everyone to kind of be very cautious on this one. We have Thanksgiving coming up, we have some holiday coming up, and people really have to be very compliant and be very careful on this one. So yeah, we have some increase here in the positivity rate, and we have to approach differently somehow to kind of pass the word out there for people.
So in the meeting last night, what were some of the discussions then, in terms of how we're going to handle this, what we should do?
Yeah, I called off the meeting last night. We met with some few key people last night, just try to gather some thought to move forward. And then we resumed the PAC meeting on Thursday. We really have to make sure that we can contain this virus. We cannot go backward. This is something that we commit to go forward. Go backward I don't think it's a very good option at this point. We just have to go through this, make sure we do refocus on certain population, certain age group that we can see that they have a problem, and keep going forward. Because I think we can control those populations in age group. We can do an okay.
Okay, what population and what age group are you talking about?
Yeah, because there was something going around on the WhatsApp, Doc, about the breakdown of the different ages and the number of positives per age group.
You can see, right? I mean, the 20 to 40 years old, I mean, they take off like a rocket ship. I mean, where we see in the clinic level that, the 20 or 30, they admit, yeah, we've been gathering, and when they turn positive, now they start worrying about the family, the parents, the grandparents, and that's somehow those, Dr. Kai Akimoto and their group there did some type of Zoom conference this past Sunday, and try to figure out how to get the message across to this group of Millennium and Generation Z, I guess, and they don't read the jig, they don't read anything, so there's a different message we have to come across to them somehow that kind of educate them on what's going on, and what's the because they're not sick. Those guys, they get sick a little bit and they're very down like the 4 years old or older. But we had to pass on the message in a different way to this age group. But yeah, if you look at the jig and the number 20 to 40 years old, they are more than half of the positive. Close to 60%. It is a huge number, and they keep rising every day at a very rapid rate. So we have to reapproach that population, the age group. And then, certain population that typically have a house a household that have a lot of people, because once there's one positive in that household, if you have 10, 15 people that live in the same house, potential you can add 10 to 15 positive in the next few days.
Wow.
So you see that number going up really quick when you have one person positive in a household of 10, 15 people, and that's not unusual. That's kind of average. So we have to learn how to put up some type of rapid response team and go out there and kind of contact that positive right away. I mean, within the same day, and either take them out so that way you can kind of isolate away from the rest of the family. Just because from 1 go to 15, very easy. We already see that already.
Right, Doc. We have a comment here. Young people have the most positive cases, but the older people are paying the price. They need to take this more seriously.
Absolutely, and I mean, they don't realize that until they turn positive, and we see that every day. You know, when they come in, now they in a shock phase. You know, they say, "Wow, you know, it happened to me." You know, now I'm working with my family. I work with my parents, my grandma at home. So, but we don't want them to wait for that long because, you know, like I said, it affects the family a whole lot when they go around. And they do go around with no masks and they hang around with no mask. That's a problem.
All right. Are these young people asymptomatic? A majority they're going around and they just don't know?
No. You know, when they come in, they sick. You know, they come in. I have congestion. I have sore throat, and that's a typical symptom that they have. It's just I'm congested and I have sore throat, and that's mostly the main complaint of young people. And they don't have a fever. They just like a regular cold. But now they realize, hey, I might have COVID, and so they come in and get tested. And yeah, sure enough, they have COVID. So, but that's something that I think Kai Akimoto and the young generation, they are working and put some PSA, some video out there in the Facebook and the, you know, all the website that the young generation are using rather than read the jig. So
they got to make an OnlyFans with emojis, just like all emojis. Wash your hands, stay home, do things.
There's a comment here. Has the advisory group considered a curfew that might possibly help?
You know, I tell you, it's nice, you know, that stuff, but I say, I mean, we got to learn that, hey, you know, certain things we got to move forward. And I think that going backward and doing a restriction right now, kind of halfway, it's really hard to do, to go backward. You know, I mean, to go and complete lockdown for 2 weeks and very strict and nothing moving is the harshest thing. I know if we do that, it will work, but I don't think that's a good idea. You know, it's really.
You think it would work?
Interesting. There's this.
When there was a lockdown, we still had high cases.
This time, but he's talking about a real, like the OG
like
PCOR
the roadblocks,
one. Yeah, the OG one, not this let's make everybody happy lockdown.
Yeah, I think the first lockdown is very effective, but that's a very harsh. I tell you, personally, I don't think it's a good idea.
But personally, you think it would work? You think it would work?
And control in a different way, and approach certain population, certain group. And we have to do things different, but to go back, I think that's not a good idea, you know. But that's my opinion.
Yeah.
So,
well, I mean, you have an opinion, and you're the chair of the PAG, so your opinion's got some power to it.
Yeah.
But Doc, let me ask you this: your professional opinion, or personal, do you think a harsher first lockdown, PCOR 1, real PCOR 1 style, do you think it would help to stop the increase in the spread of the virus? Yes or no?
Yes. The first one.
But I think also the first one, people were genuinely scared and they didn't know what to expect, and so they followed the directives. Now, would you say, though, that there's kind of an issue with trust?
I think now, Sabrina, mostly because of fatigue. I think people are tired of living this COVID era. You know, you can wear masks all day and you can social distance for some period, but after that period, unless you take a different approach and control this virus, people are getting tired. Those are you know, COVID fatigue, and they just don't want to. Not that they don't want, they just sometimes want to do something different because they've been in this mode, you know, for the past 7-8 months already. So I think that we, as leader, we just have to kind of look at things, realize that people are getting tired. We have to do things a bit differently. So to move forward, we cannot go backward, and that's the thing. So we have to get our hospital get better, get the identified certain population get the contact tracing, the isolation team. I mean, that's the most important thing to really move forward and isolate and quarantine all the positive really, really quick, because that's the main things right now. But I'm telling you, one positive can turn the whole family of 10 to 15 into another 15. So the number will go up really quick and exponentially if you don't control the household. So that's the stuff that we have to move forward in a different way, rather than goes back down again.
Right.
We have to.
And you did say that, we can expect more, an increase, right? Like sort of another surge. So what are we doing now to prepare for it? Are we getting more nurses? Are we getting an alternate care facility stood up? What's the plan?
The plan, I have to go back and again, is that the rapid response team, we got to stand up really quick and we might have to, the PAC talked about privatize certain part of this thing to kind of help public health. It's very important to have this robust, contact tracing and isolation, and is a part of it's a private-public partnership, and got to do something and try to get into it. And the key here is to get to that positive within 5 hours. We have the good testing ability now. We can test people. We know right away them positive. That process of initial contact and isolate and get the family to understand is very important. This is how we move forward, and that team or whatever who belong to that team is really need to move really fast. We still have people that are positive and have not been in contact, for tracing now for 3, 4, 5 days, and that's where we're gonna lose the battle if we don't have a very robust system on it. And we got to say that, hey, in order for us to get better and get this item moving, we have to know that, hey, we got to improve at a certain point, and that's the key, that we have to move forward. We, like I said, we know where we need to improve. Like I say, the age group, certain population that typically have a lot of people in the household, those things we got to get a hold of. And I think
for clarification, are you saying that we don't have a robust contact tracing program? Because if the oversight hearing last week, it seemed like, oh man, we're doing so awesome.
Yeah, it's
even Hawaii, the state Hawaii, and everyone else, that's just probably the weakest link of them all. And this whole fighting for the COVID-19 is that the isolation and the contact tracing. In San Francisco, they have a huge team, and they hold around 80% or so on the success rate of try to reach somebody that's positive and isolate and start a contact tracing. Right now, I tell you, we have to say that we don't have the most robust system of them all on the contact tracing. As a physician advisory group and everyone else, we really need to kind of delve down to the number, and we need to pull out to see what percentage of positive case that we have to reach within the first 24 hours. We need to delve down to how much percentage of the positive that we started contact tracing. Those are the number we need to pull out, because if we don't pull those number out and put that, for people to make decision, it's very hard to move forward. So right now we really need those. I don't know. I still feel like we're very short. We need to hire a lot more people. So the governor agreed, so that we need to hire a lot more people. So we need to stand up that in order for us to move forward, and we really need to. So the PAC are harping, for us to have a much better contact tracing team.
Gosh, did
and
you watch
isolation.
that oversight hearing? It really did sound like
I did.
we're doing great.
Yeah.
We're hiring.
I know, but I mean, I watched that, and personally, I look at it and say, I don't think so. We have to do better, and I think we have to do better than that. At 5 to 7 months, 8 months in, we got to have those data in front of us right away, and we don't need to go and look for it. So it helped us to make decision for the governor. It helped the public to understand more, and because remember, this is the whole community. It's not just the PAC, not the governor. It's the whole community. So I think the community have better number, better understanding. It would be much better successful to contain this virus.
Yeah.
So we still pushing it, guy. I mean, the physical advisory group, we push it every day to have those numbers available for everybody, so that way we can all fight together.
We have a comment here. Jamie Lynn writes, "It took public health over a week to contact me for contact tracing. My test results came back before I got any phone call. I do understand public health is overworked with everything going on."
Yes. And Christopher, we're pushing it. I'm telling you, that's the key part here. Like I said, we cannot go backward. We only can go forward, but we got to do things differently.
Yeah, but it's just kind of scary that you're saying what you're saying in regards to public health when they present a picture that, we're doing good. And, we're supposed to trust public health in terms of guiding us through this whole pandemic. And if you're saying I want to say I did watch the part where they did this presentation and they said, contact tracing. Okay.
They said that they contact people before they actually test.
Yeah, but you gotta understand, right? This I was talking to my kid, and they are also, when they sit at home, they listen to news everywhere. So it's really, this part here is very big. It's not unique for Guam. You understand? This is where, every public health around the world that I don't think they ever deal with this type of before. We can survive with regular breakout with dengue fever, with the mosquito and with TB. But for this scale of pandemic about the COVID-19, I don't think it's a lifetime anyone ever see one before.
Mm-hmm.
So it's something that public health and location will have problem.
Mm-hmm.
But the key is to know that you have a problem, and the key is to move forward to fix it. So that's the thing. So we all, like I say, the meeting that we need last night is basically to refocus again, to get the PAC and to move forward with public health, and improvement their process to get that. And that comment you have is very true. It takes too long for the contact tracing to reach the positive, and every day that you don't reach that person, you get further behind. And that's something that within 24 hours we set the metrics that those steps have to happen within 1 day. So again, that's the number that we like to have people present to us in order for us to move forward in a comfortable way, and for us to make better decisions move the whole economy forward.
Right. Doc, one of the things has been a recurring theme, at least this week. It's people that we've interviewed that have said that the government, they lack compassion in terms of, for example, the 3 sisters that came in after their sister died here on Guam, and their hardship exemption at first was denied, and then all of a sudden it was approved. They got to, they tested out of quarantine. Then you have a situation, non-COVID related, with Gayleen Cruz, whose husband has been sick. He's been at the Guam Regional Medical City, not having, he doesn't have COVID, and she's unable to be by his bedside
As a caregiver.
as a caregiver. Yes, and he's having a surgery on Thursday, and she has been trying. She's written to elected leaders to see if some sort of caregiver program can be implemented.
You know, Sabrina, I don't think the general term and the governor's the government is not compassionate. I don't think that's true. Okay, I mean, the case is like the quarantine, the three sisters. I read about it, and I really feel for them, and that's the Q factor quarantine team. Whatever decision they make, is those person decisions, made by that team. It's not the government. I tell you, I don't think overall the government we feel that way. I'm not the government, but I don't think just the same thing as the government, try to help the situation on the COVID death. They are compassionate. It's just that those decisions is made by a team that, like I say, it need improvement. When personally, I don't think that I would make the same decision for the three sisters. We can test them out and we can send them out on some special occasion, let them go and spend time with their family when they're here. Those decisions I would make. But again, it's depend on the team that make the decision. And we try to, as a pack, try to get involved and make those decisions. So it kind of make an exception in certain case. And regarding GRMC and the caretaker, no, I just read it last night, and it's very hard. That we are in the upswing of COVID, and yet, as you can see, just like the GMH have some positive and they don't know if that come from the visitor or come from other people or not. But once you allow a visitor come back inside, when you see an uprise on the rate, is hurt a lot. I mean, you can expose that hospital to a lot of positive if you have a person come in. And remember, GRMC is a private hospital, and they have to make decisions to protect their staff and other people also. And I feel for the patient. And I tell you, as a physician, it really hurt to hear what she say, on the picture. But all we need is just one positive come in the case, and that whole unit going to get affected. And it's some, you can walk in, you feel fine, but 3-4 days later, you start come down to COVID-19, and now you have to trace back. Oh, did you go to the hospital? You have a lot of other patient there. Now you have to trace back the whole hospital. So it's a very challenging. I don't think that GRMC make a decision that is not for the patient. They have many patients in the hospital, so they have to take some extraordinary, decision to try to protect other people in there also. I mean, I wish that that we have a better case scenario. It's just that this COVID-19, we don't see them. We don't know who have them. You can feel well one day and you get sick the next day. And that's what I'm afraid of myself every day.
Yes.
I don't know. Every day I come home, every time I feel something, I feel like, oh my goodness, did something to protect myself when I see my patient. So it's you can't see them. And, we often see a patient for a follow-up visit that in the clean unit, which is no one's sick. And then a week later, we found out that person is positive, and we had to go back and relook at all our protocol for that patient to see that we take all the necessary precaution, protect us and protect other patient. So it's very hard. I feel for the caretaker, but at this time with the COVID-19, those decisions sound very harsh, but protection for everybody. And I apologize for the caretaker. And I mean, I feel bad. But if we put our emotion in every case like that, sometimes it come back and bite us a whole lot. So, again, my head for GRMC for making decision like that, but I think there's a purpose behind it.
Doc,
but guys, the government does have. I don't work for the governor. I tell you, I'm a private citizen and as a volunteer, and I tell you, just a decision that to try to support the COVID death. It's not the best decision or not, but she did it because she feels obligated.
Well, I mean, you say you don't work for the governor, but according to when she appeared before the Guam Medical Association way back when a public health emergency is declared, she basically controls all the health clinics. She controls GRMC. So I'm not sure, was that a miss?
Yeah.
Did she misspeak or what?
They asked to take over, and we opened our door to see everyone, especially Tier 2. We don't. If you don't have any money and you don't have any insurance, we open the door and see one. But those are stuff that the government asks us to do. I don't think that anyone can dictate the clinic of what to do. We do it because that's our obligation for the island. But I think that's a normal thing. But I don't feel like we got take over. The Tier 2 and some of the smaller clinic are openly take everyone just because I think this time in the pandemic we kind of need to stand up and doing that ourselves. So
Doc, we just have a minute left here, so if you could in a minute tell us community mass testing, do we need more of it? I think he froze.
Oh.
Yeah. He was going to say yes, though, I'm pretty sure. All right. We'll give him 5, 4, 3, 2. Okay. Well, thanks, Doc. Enjoy that virtual Malasadas in the
Doc.
KUM News Zoom room.
Stay safe.
Yeah, it's Wednesday, October 7th. We're KUAM FM in Agotnia, Guam. To our viewers on KUAM TV, it's been a blast this morning. Thank you so much. You catch the rest of the show. There's a whole lot coming up. You know what they say, miss a link, miss a lot. That's on the way. Okay, so KUAM TV, está. Adios. Let's kind of go over some of the comments here. This is the Breeze 93.9, by the way, the link. I just want to run off some of these comments. A lot of people were commenting during Dr. Hoa's interview. Igna writes, Gov Guam is wasting money on this hotel quarantine. They should follow Hawaii standards. Robert Kittichu writes, what the people of Guam should do is test every house one by one. Teresa writes, Dr. Ho is saying a true lockdown, shut down everything, will work if people truly follow the stay-at-home order 100%. But he's saying people are restless. Therefore, many are not following it, so they'd have to approach this round differently. Also, with the many interviews done, the business community can't afford it anymore. It's a hard balancing act.
Aaron D. Guzman says, we're all in this together. Please stop asking unnecessary combative questions, which clearly sounds like you're trying to pit government versus everybody else.
No. Rosemary LaGuardia writes, what he is
Sorry,
saying
but
is,
if there's people hungry out there, people are dying, I'm going to ask whatever I want to ask.
Yeah.
But thank you.
Thanks for listening. Rosemary, what he's saying is not matching up with public health. Johnny Cruz.
Exactly. And when it doesn't match up with public health,
Then you
I'm
got to
going
ask
to
questions,
ask.
of course. Johnny Cruz writes, it's the PUA and the stimulus that caused this surge, because if you give people money and they have no job, what are they going to do? Party and stroll around. But if they don't have money, they can't afford to party and stroll. Okay. Rosemary, mixed messages are not allowing the people to understand the importance of following mandates. Robert, people aren't taking this seriously. Go and get tested. It's other people's lives that you're dealing with. Marie Rages, here's a winner. With this many cases, the contact tracing team has a lot on their plate. Guys, just stay home. Let's get Dr. Hoa back on. And yeah, Doc,
That's really, at the end of the day,
yeah,
what people need to do.
we were asking about
anyway,
community mass testing. Go ahead.
Yeah, I think we need to be doing a lot of target testing. We know where the population that have positive right now. So we need to go to those population. We're gonna target testing that's the main focus that we have. So I think that they talk about already. So we're going to focus on the one that have the most positive now. And so you can probably see the next 3 weeks or so, we're going to go to a certain area and do the test. So we need to basically capture that population in order to control it.
Yeah, but we've been talking about target testing, for a while. I remember when you first mentioned the rapid response team. That was a couple months ago. Is it just we just never really fully implemented that, or?
No, I think we did some target testing in certain group, Sabrina. But now, that remember the pandemic kind of changed on a weekly basis, and now so we know that certain group have a rise in the rate right now, so we're gonna go after that group, and in order to kind of to curb this positivity rate. But we know which group we have to go to now. Public health have to. I think they already start to ramp up and plan on this target group already.
PSAs, you mean?
Oh no. We're talking about go out there and a certain area and test everyone. So it's not testing Diego, it's not testing and Derido, it's not testing Humanic. It's just testing certain group of people that we identify that hey, there's a big increase in that group.
Yeah. Okay, Doc.
Okay, so we might go up to a certain area, not the village. Okay. But again, ask people to really not to do so much gathering. And I feel for them. I know that they want to gather for their family and celebrate the birthday of someone. But when they come in positive, they know, oh, Doc, I make a mistake. And that's something that we like not to hear them so much. So ask the people, I know COVID fatigue and all this thing we've been in for a long time already, but just be patient, like I said, we have Thanksgiving coming up, and that's something that we're not looking forward to just because we know they might have an increase in the rate there.
Right. Okay, Doc. Thank you. Right on.
So,
thanks,
safe,
Doc.
guys. Okay.
You too. Wash your hands.
Bye.
Okay, bye. Yeah, we just put in a virtual hand washing station in the Zoom room.
Chris, I wanted to say something because,
Yeah,
when I was sitting back, in the background, observing and everything, the one thing that Doc really said that really stuck out to me was that they've now identified, a particular demographic that isn't following, the 3 W's, practice social distancing, wash your hands, stay 6 feet away, wear your mask and everything like that. And the PAG, obviously they're not, in the marketing business. That's not what they do. But I wonder if they would suggest highly to Adelup or whoever it is that, they perhaps bring on a consultant, do something like that. People like from the marketing side, from the advertising business and everything like that, they can actually structure and distribute them and package the message differently so that it would resonate with that younger crowd who, they don't read the newspaper, they don't listen to the radio, they don't watch TV. This we know. They don't watch the news. We've known this for years. And if something isn't on Instagram, almost in the form of a meme, it's not going to resonate with them. So maybe just to marshal the message in a completely different way would finally break through to them, and they'd be like, oh, okay, I get it. And the fact that they keep saying, wear your mask, stay 6 feet apart, wash your hands all the time. We've said this for 8 months right now. And with that particular generation and everything like that, advertising used to be that you say something over and over and over. It's the blitz effect, right? It's going to stick and people are going to do it. These days, you hear something more than 3 or 4 times, you tune it out. And that's the way that young generation is. And so I'm wondering, are they just going to say we need to have this message directed towards that group who is problematic in terms of the infections, in a different way, because we're just not reaching them.
We're going to take a break. It's 8:06. This is The Link on the Breeze, 93.9. Good morning.
The holidays.
GU Self-Storage, conveniently located near the Harmon McDonald's. We offer affordable rates, online payments, and auto bill pay for your convenience. Plus gate access daily from 6 a.m. to 9 p.m. Call us today at 648-7867 for more information.
Celebrate National Pizza Month with a Pepsi Pizza Report. Pepsi helps celebrate this tasty month with an easy way for you to win Pepsi and pizza. Post a photo of yourself enjoying your favorite Pepsi beverage to KUAM News, Uno Instagram, or Facebook pages to enter to win Pepsi and pizza from one of 10 pizza sponsors. Catch the Pepsi Pizza Report every Thursday on KUAM News The Link Morning Show and on the social media pages of KUAM News for reports, tastings, and everything pizza and Pepsi.
Your generosity can change lives. Disasters won't stop during this global pandemic, so neither will we. The Guam chapter of the American Red Cross is calling on the continued support of the community to assist with their mission of providing disaster relief and recovery efforts, military family support, and life-saving training and certifications. In times of emergency, our support will not waver, and we pray that your support of our efforts will continue as well. We invite you to join us in commemorating our 20th annual signature fundraiser virtually this year by supporting the Red Ball in a Box. We will be delivering special red boxes, which include a 4-course dinner from Micronesian Chefs Association and wine to our patrons and sponsors. As a sponsor, your company and message will also be featured in a special television tribute to the Guam chapter of the American Red Cross. For sponsorship opportunities and more information, please call 688-0280 or visit our Instagram or Facebook page. Let's support our community. Though we're apart, we're still together in generosity and support.
Pepsi Guam Bottling, a local company. We produce your favorite products right here on island, like Pepsi, Mountain Dew, Hanum, Chamorro Punch, Tropical Ice, and more. We've invested millions into local production and will continue to upgrade our facilities and provide local jobs so you can truly buy local. Our long history of producing the freshest and best products will continue. This is our vision. Pepsi Guam Bottling.
What is Guam COVID Alert? It's a community of people who care about the safety of others during these unprecedented times. It's thanks to the PathCheck Foundation of over 1,000 volunteers collaborating from all over the world to create a unified solution. It's Apple and Google partnering up to develop a Privacy by Design app that uses randomized Bluetooth keys instead of identifying information to send notifications of exposures to others. It's PathCheck, Google, and Apple's marketing teams providing marketing toolkits to ensure Guam has all the possible resources to make this effort a success. It's the Governor's Office, Public Health, and the Office of Technology uniting with all these experts to find a solution to help slow the spread of COVID-19 on Guam. It's all of these things coming together for one simple thing: to protect our neighbors, brothers, sisters, and all the people of Guam, especially during these times of uncertainty. Help Guam stop COVID. Add your phone to the COVID fight. For more information, visit guamcovidalert.guam.gov.
We got your 6.
At 6 a.m. with The Link on Breeze 93.9 FM. Bree and I connect you with all the latest news and information you need to know to start your day.
Then check back with Guam's news leader at 6 p.m. for the day's top headlines with KUAM News Primetime.
From 6 a.m. to 6 p.m. and everything else in between with KUAM Digital, we got your 6. 9:13. Thank you guys on our K-Wave News Facebook Live feed. Ben Kai Santos. Hey, Hoppaday, Chris, Sabrina, Jason, and the K-Wave News team. 3 W's daily, always. Marie Regis writes, honestly, on the link, they take a different viewpoint depending on the guest or comments. They get a good mix of people on, and they get the information out there. But I take comments, remarks with a grain of salt. Watch your salt intake, girl. Good morning, 637-0094. That's our number coming up on the show. 9 o'clock, KUM News Decision 2020 candidate interviews. And candidates on this morning, we have Minority Leader Senator Tello Taitagui, Democrat candidate Fred Berdalio, and Democrat candidate John Ananich. Also on the way, Red Ball in a Box. Tell you about that. It's pretty cool. Also, Maria Pangilinan, Guam Election Commission, and Lillian Posadas is coming on for a hospital update sometime before 9 o'clock. We saw a big spike in hospitalizations yesterday, and just heard from Dr. Hoa that in the next couple weeks, hospitalizations are going to become a factor again. All right, as there's a statement out of the governor's office, because we kind of had asked, or I'd asked Crystal this morning, Crystal Paco, San Augustine, if they were tracking any additional easing of restrictions. Because remember, we had the restaurants on this week, and I was like, oh yeah, I'm pretty sure by the end of this week they're going to allow dine-in. I mean, it was just going off of what decisions they had been making. But Crystal sent me this statement from the governor, and I'll go ahead and read it out to you guys. Nothing is more important to Governor Leon Guerrero than the health and safety of the people of Guam. That's why she has taken aggressive and sometimes unpopular steps to slow the spread of the COVID-19. The governor has been clear that our policies will be directly linked to the data we have. She's especially concerned about the increase in new cases, the increase in hospitalizations, and the increase in COVID-related deaths. For these reasons, she will not be lifting any additional restrictions this week, and the island will remain in PCOR 1 with a safer at home advisory. As we work to save lives and livelihoods, we emphasize that mandatory quarantine for incoming travelers, strong contact tracing, and the choices we make individually are the best tools we have to decrease any increase in COVID-19. Please avoid excess travel, wear your masks, social distance, and wash your hands. We must protect ourselves, our families, and our community. Well, there you go. No dine-in this week, guys. Sorry. My bad.
Okay. Chris, we've talked,
Yes.
I've talked on this with, you and Bria on this, and, we kind of said that you guys favored, and it was completely theoretical and everything, but in the beginning, I asked the two of you, and I said, would you guys favor state of martial law? And that is about the most extreme that you can get. And you both said yes. Do you think at this point it might be...
Did I say yes? I want to see the tape on that.
Yeah. Go on our Facebook feed about 8 months ago. You may have to scroll a while, but you'll find it. Do you think that is a possibility at this point? Because if even Dr. Nguyen said...
Yeah, this is what I feel like the reality is. And we heard it from Dr. Nguyen. I mean,
stricter measures are...
We can't go backwards. We have to move forward. So this, to our government, this is acceptable, right? This is the baseline. And I really don't think that, and we've heard it from Lieutenant Governor Josh, they're really trying to retool the whole open, close, because there's just so much pressure from the businesses.
Right.
So there's no way. This is not a cha-cha. We're not going to go back. I mean, no matter how many people die, I don't think we're going backwards, and we're hearing it from the main man on the Physicians Advisory Group. But we have to keep moving forward.
He also indicated that, and Dr. Ann Pobutsky, the territorial epidemiologist, last week even said that the governor seems like she's trying to open things slowly and incrementally. If, and that was like the big statement, if people can behave and do what they're supposed to do.
Yeah.
The problem about this whole thing is societal. It's not necessarily, I mean, the health thing is obviously like the most prevalent, but it's the way people are behaving or not behaving.
No, I mean, I'm not going to put it all on our people because I feel like there's no trust. People don't really trust what the governor is saying
Well,
anymore.
yeah,
They
it's not every single Guamanian
and the
on
mixed
here.
messages. There's just too many. I mean, do we take it serious or do we go get a tattoo?
But remember, what was it? Maybe about 2 months ago now. The second to the last time Dr. Vince Akimoto was on our show, he said, in his estimate, he said, it seems like a lot of people are still going around, still doing stuff. And this was back in late July. And he was saying 5,000 people ruin the way of life for the other 163,000 of us here, right? But if the problem is people not adhering to and abiding by the second lockdown, and again, it's a recommendation. She's saying, please stay home. Please don't go out. Please, not, I'm making you do this. And that was 5,000 back then, according to, the doctor's estimate. Right now, you can realistically say it's a lot more than that.
Mm-hmm. I just thought it was interesting that Dr. Wen said that we can't go backwards. But then he said that a strict lockdown where you really lock everything down would work. So what are we doing here? I mean, that's
why I asked the question to you with the whole martial law thing. I mean, that's
yeah, that's kind of scary, Jay.
Yeah.
But I mean, obviously, if the chairman of the Physicians Advisory Group, in his personal and professional opinion, believes that a stricter, more stringent OG PCOR 1 lockdown would help flatten this curve, because we've been on lockdown since August 14th, bro. It's almost 2 months.
Like, you and I are in our mid-40s, and you and I have never been through a state of martial law in our lifetimes. I mean, we've been through super typhoons where the mayors will basically say, okay, stay inside, don't go out at all costs. You can only come out when the water buffalo comes around if you need water for your family. State of martial law would effectively be, Chris, you walk outside your house because you're doing something, immediately a National Guardsman would say, sir, get back inside your house. I know this is your own property, but you can't do that.
Yeah, I don't think we need to go all the way to martial law.
It's really scary.
Yeah.
But you know what's really scary too? The virus continuing to spread.
Yeah.
So it's a very complicated problem.
It is. I mean, and I don't think we're going to see these businesses that are open now. I don't think that they're going to be like, okay, guys, we just need to stand down for a couple weeks, because the political pressure on the governor, it's too great. I mean, she already caved. So how do you go back from that? We're already in a PCOR 1 where you can do anything you want, basically. And yet we're sitting here wondering why the numbers aren't going down. Why people keep dying. Well, it's obvious. We're in a fake lockdown. I just thought that was pretty interesting that you have on the one side, Dr. Hoa saying, this is what will work, but we're not going to do it at all. And we can take a short break, come back with Superintendent John Fernandez next. Oh, he's right there. Okay, so we'll go and bring him on.
10 seconds.
It's 8:21. Like I said, we've been on this PCOR 1 lockdown since about August 14th. There were a couple comments. I don't know why. Marie Ray just writes in, I don't know why people can't take this seriously when someone has died almost every day this month. Chin Thomas writes, 2 weeks after every easing of restrictions, there will be a rise in hospitalizations and deaths. This is to be expected. Elliot Rodriguez, maybe if the executive orders had any teeth to them, we can't do anything if people don't follow the restrictions. Come on, senators. He also commented, 40 people in the hospital, and we don't know how much more were admitted since last night's JIC. Gene writes, need to go back to stay-at-home orders or even order a curfew. So there you go. That's what the people are saying on the Facebook. 822. Superintendent John Fernandez, the Guam Department of Education, joins us in our KUAM News Zoom room. Good morning, John.
Off day, Chris. Good morning.
Thanks for joining us. We'll just go ahead and start. I know you got a lot to update us on, so we'll go ahead and give you the floor and do that, and then we'll pop in with some questions after.
No, absolutely. Well, first of all, I just want to inform the community that there's been a lot of questions that we've been receiving over the past few weeks about laptops being distributed. So right now we still are getting those questions, and I want to let everybody know that they do very much need to be in contact with their schools, give their schools a call if they haven't yet received information about applying and receiving laptops. So there is a directory on our website, www.gdoe.net, for contact with our schools. But basically, the schools are handling the application process. It started last week, and my understanding is that distribution also for some of the schools started last week as well. and we'll be pushing those laptops out. I think JFK was able to do about 50 a day, so there is going to be some limitation on how many computers are able to push out daily. But over the next 2 weeks, we are anticipating distributing around 8,000 laptops and tablets to our secondary school students, and hopefully expand the online option for many of our students. So if you need to apply or you have questions about the laptop distribution, the first place to call is your school. And again, for phase 1, we're talking about middle school and high school students. Elementary school students, we will be looking at distributing later once we get the new equipment coming in, and that'll happen probably towards the end of the semester. So that's what I wanted to say about laptops. I know we've got a lot of questions also about internet access, and so I know we testified before the legislature yesterday to clarify where we were. Again, the funding that we're using to support internet access at home is coming from the governor's office, and I know they've earmarked about $8 million to support that effort. I think I'm not sure they got approval of their budget yet, but once they do, our plan is to move forward and to procure internet access from our providers to service our families and students who need internet access to take advantage of our online platform. So again, that's going to take another month or so to really get done. But it is on the way, and I wanted to just let our parents know, because we do get a lot of calls, a lot of excitement about it. I know there are a lot of families who have been trying to deal with the hard copy form of learning, and that's been challenging during P-Core 1, and it's just a completely different way of trying to get your work done. So we do hope by the end of the semester we will see a significant amount of students now going completely online, and that'll help us and help our teachers focus in and improve what we're doing on that side of the learning equation. So I think additionally, I wanted to, I think we haven't made it up. We definitely haven't made a final decision, but there are several decisions that we are needing to make as we get through this part of the semester. 2 issues that have come up that the board will need to take action on this month are looking at grading policy for this semester. It's been very difficult to figure out how to give grades in the normal way, compared to regular years, given the fact that a lot of transition of students onto the distance learning platforms. We're dealing with a lot of kids that we've got to reconnect to the school system, so we know some are behind. And then online assessments are just really different from doing them in person. So we're looking at grading policy, we're looking at attendance policy. A lot of our teachers are asking, how strict do we need to be if someone's on our online class but didn't show up for their online class? Is that tardy? Is that absent? So we're reviewing those policies. But I think the most important issue is that people are asking us, is there a final decision on classes, on face-to-face for this semester? And we're getting close. And I think, if I had to make it today, I think that we're in a position where we have to, delay face-to-face until next semester. But we haven't made that official yet, because we really do want to see and make sure that we've got the laptops out there and that we have a better sense of the number of kids who are still missing and not connected. But, based on the public health situation, and we've been tracking that daily as everybody else has, it doesn't look like we'll be in a position to effectively implement face-to-face, if we don't get there until mid or late November. It just won't make sense to come back for a couple of weeks and then go on break. So, we've been discussing with the governor and her team about reopening possibly next semester. And I think the challenge is, if we're going to open in January, if that's even a possibility for face-to-face instruction, we have to have that discussion right now. And so, we're going to be talking to her about how to open that discussion again with her and the doctors, public health. We're working on what we call a dashboard, really tracking day to day those risk factors that are relevant to the schools, so that we have, and this is a framework developed by CDC that we're adapting for Guam, so that we can have hard data and use the science and use the guidance from CDC to guide us, over the next couple of months. I really am, I know that all of us want our kids to be back in school, but we can't make those decisions based on the last letter or opinion piece or editorial about why it's important. We know it's important, but safety is the top priority. And so we really are looking and leaning on the science to kind of help us guide our decisions over the next couple of months. But as you know, and with the numbers, and I've been listening to your show, is that there's just high anxiety levels. I mean, our principals, our teachers, our staff are working really hard, but also, having to deal with their own anxieties about safety at the schools, safety in our operations. So it's really going to take a lot of work to communicate and reassure our entire community, our students and families as well, when we get to that point and say, where we're able to say, come back to school and come back in this manner and, and know that you're safe. We were even going to be revisiting whether we come back all at once as a district like we were planning to on an alternating schedule, or whether we look at certain grades, look at certain groups of students. We know that our special education students, our students with disabilities, their families have really expressed to us the difficulties and challenges in educating kids at home with the online, with distance learning versus the supports that they would normally receive at school. So all of those discussions we are restarting again internally and with the governor's office, and we hope to have a more public discussion, keep the community informed as we go through these next 2 months, because we're not going to reopen on a dime. We're not going to be able to change direction that fast. It's going to be a steady process, and the public health situation has to improve. So let me go ahead and stop there. I mean, those have been the issues that have been coming up for us, the technology, and then the question about reopening. But I'm sure you may be getting other questions or comments, and I'm happy to answer any.
Hi, John. Where is the Guam Department of Education in being able to reach the students that have not yet been able to participate in any learning since the first day of school?
Yeah, that's been a major concern to us. And again, over the summer, we had our students register for their models of learning, and we saw that 4,000 students that we expected to respond had not responded. And of course, we just figured that, okay, once we get to the first day of school, they're going to show up, and we're going to get a lot of them just by virtue of the fact that they physically could report to school, and that should take care of a majority of those cases. Unfortunately, we didn't get a chance for the students to report to school. Mm-hmm. So since the first week, we've had to rely on phone calls and emails and whatever other ways of communicating that we had on file and on record. And, we started over the summer with staff. As teachers came back, teachers then participated in that outreach effort. And then, just over the last couple of weeks, we've really deployed our social workers and our student attendance officers to take over that operation and really, work over, double time to get that work done. So we were at 4,000 at the beginning of the year. We were about 2,800 students, maybe 2-3 weeks ago. And then we've been able to reduce that number or just over 1,000 more. So we have about 1,700, a little bit over 1,700 students that we're still trying to connect with. One of the challenges, of course, Sabrina, is that, if you can't contact anybody, the next step is a home visit. But during PCOR 1, we're not allowing our employees to go out to people's homes. And I don't think people will be, welcoming visitors to their homes during PCOR 1. So we are just really holding on until we get to a situation where we can do that. We will be working with the Mayor's Council just on the contact information. If they have different contacts, updated contacts, in case these families are being served by the mayor's offices. But other than that, we're really going to have to wait to a situation where we can go out to the homes and check on the families. Some of the anecdotal, information that we have is families that have just moved, have had to, I don't know that they were evicted, but just had to relocate their housing because of an inability to pay rent or just a need to relocate somewhere else on the island. We know that there are a lot of economic challenges for our families. So we know that there are families who are saying, hey, school's not the first priority for us right now because we're looking at housing, we're looking at our income, we're looking at food, water, and so forth. And, we also know, we're trying to work with the Global Dorm with our homeless families to connect to some of the kids that are over there. And we just, recently received some census information about the kids who are there so we can reconnect them to school. And these are kids from all over the island who are now, centralized in a central homeless facility. So we hope to make more progress, and that's really been a tough. That's been a challenge, not just a challenge in terms of reaching the kids, but we know that there's a possibility, a probability that when we get the chance to dig into these cases, we're going to see more than just kids who didn't want to come to school. We're going to really be face to face with families in traumatic situations that we really have to be aware of and try to address as a community.
I did want to ask, on the releases that we get from the Joint Information Center, it always makes a notation of the latest round of GDOE employees that have tested positive for COVID.
Yes.
Do you have a final account on how many exactly employees of yours have tested positive?
Yeah, and well, let me first say this: we have been shut down for most of the summer. Mm-hmm. We did come back for a couple weeks, and then we've been shut down for the most part ever since. Of course, we do allow teachers and staff to come in on, as long as they are coming in and under safe conditions. Meaning, we don't expect. There's no faculty meetings. There's no staff meetings taking place. They're going to their rooms because they want to use their rooms for their classes, or they're participating in the distribution of materials and food. So it's pretty limited. And again, we've been shut down for the most part. All the cases that we have about 58 cases that we've identified since the summer of GDOE employees. However, let me clarify that these are not, that the majority, if not all, of these cases are being discovered through contact tracing. Mm-hmm. So what's happening is that they're being identified and as contacts for positive cases that have happened outside of the schools. So there isn't, I've been very concerned and working with our chief nurse supervisor to track and to be aware of any possibility of spread within a school, based on the fact that people are together at school. But for the most part, I haven't had any evidence of any spread within the school facility. It's all coming from outside in the community. And, but again, we just feel that it's important for our stakeholders, if they're going to trust the information that we're going to give them about being safe to return to school, about coming to pick up their food and their supplies, that we ought to share all the information that we can about the impact of COVID-19. So sometimes it seems like we're the only agency that has any positive, because every day that we get a case, our instruction is put that out to the community so they understand and know what's happening. Otherwise, I don't want to be in a position where you're going to say, hey, you had all these cases, but nobody ever shared it. So how do we know you're going to share your information going forward? And we definitely don't want to be in that position when we have so many people trusting the decisions that need to be made.
Are any of these teachers, though?
We have teachers and staff, right? I mean, and you can guess. So so one of the calls we'll get is, we have a certain person at a certain school that's informed us, or we've been informed that they've tested positive. Usually the employee is the one who notifies us first. And then we say, we get a handle on the circumstances. Sometimes it's, my spouse was tested positive at work. I was the next contact. Now I've been diagnosed positive. And so we kind of get a sense of where it's coming from. Usually some of them haven't been to work, haven't been on site for 2 to 3 weeks, but we still report those because they are part of our DOE family. Yeah. We don't actually go forward until we get DP, public health, to verify and validate that information. And then when we do that, we basically identify, the individual school, location without giving personal, identifying information.
Yeah.
So we want to make sure we maintain the privacy, but we need to share some level of information. With
right. I was just asking about the teachers, because have they gotten sick where they could not continue to hold their classes online?
Well, there's 58 cases, so there's different circumstances. I know we do have a couple who've been hospitalized. I'd have to go back and see whether that was a teacher or a staff. But in some cases, depending on what they're doing in terms of online or hard copy, they're able to isolate at home, and depending on their symptoms, may be able to telework and continue to do their classes or work with their teams to have their classes covered for them. So it really is a sort of a collaborative method. But I think again, depending on your symptoms, in my recollection, there's only been really of the 58, maybe 1 or 2 who've required hospitalization. So so the others are going to necessarily be at home.
I did wanted to give you the opportunity real quickly. We've heard from the Guam Memorial Hospital on the 17 nurses, right, that were sent over to GMH and to GMH, and they were going through their orientation. And so I wanted to see if you had anything to say, on their behalf in terms of their decision to decide not to continue on.
Absolutely. I mean, I was very disappointed to hear the way those comments were portrayed, or where the information was portrayed. I do have a good relationship with the GMH administrator, Ms. Lillian, and we met several times on this issue. And basically, it comes down to this: there has been an ongoing shortage of skilled nurses at the hospital. This has happened before COVID-19, so we understand the needs that are there. But number 2, we do have nurses who are registered registered nurses who are licensed nurses at our schools, but essentially they function as community health nurses, just like the nurses at public health. And if anybody in the nursing profession understands there's different levels of specialties. So when we came to, stepped up to volunteer and to report based on the governor's directive, there was a decision that basically around half, a little bit over half, were going to public health to support the community health options. There were some nurses with hospital experience or others willing to train and go through orientation to serve the hospital, and they were the ones who were assigned to report for orientation, training, and eventually to be independently functioning at the hospital. My understanding of what happened is that, well, first of all, that week that they were reporting was the first time we heard publicly that there were 30 COVID cases at the hospital amongst the staff. And I was concerned about that. And I talked to Lillian about that, because I said, look, it's very hard to convince and reassure my nurses when that information is just put out there. And I've been telling them that they'll be in non-COVID areas to start out with. And, they don't have to, be as anxious as we, of course, would expect them to be. But at the same time, so with that heightened anxiety, I know they went through training and orientation. And at some point, when we met, I think GMH basically decided that training and orientation might not be the best use of their resources because of that, that process and the expending that time to get them fully equipped to be independently functioning at the hospital. I mean, there's no way you're going to get a community health nurse to step into the ICU or to the ER or to some of these more specialized areas. Mm-hmm. So I think it was really a choice of saying, hey, you know what, we can either get specialized nurses that are available. They might be coming from off island. They might be available on contract versus trying to get, these 17 nurses up to speed and fully reassured that, that they can go home to their families and be safe at the end of the day. So it really was amicable when we had that discussion. I asked GMH, do we, are there issues of resistance from our nurses? Are there issues of insubordination? Because if that's the case, that's really not acceptable, and I'll handle that. But really, it was the tone was, we understand their anxieties. We know that there's anxieties coming into the hospital setting, and it just might be too much to do to try to get them stable and settled and comfortable versus like what I understand is they had other options that were on the table. So all those nurses didn't go home. They went to public health, and they're reporting to public health to support the community health contact tracing, any testing that goes on, and handling the calls from the community. So they are still working. They just aren't at the hospital setting. So I think that's really more of my characterization of that. And again, I want to thank our nurses. I mean, they haven't been given administrative leave. They haven't been sitting at home teleworking. They've been out each and every day at the ports, at the airports, at the quarantine facilities, at the hospital, even at GRMC throughout this time. So all of our nurses, including our GMH and public health nurses, we really want to thank them.
All right. Well, thank you, John, for coming on and giving us an update. We've got to move on over to the Guam Election Commission. So appreciate your time.
Thank you, John. On your way out, grab some of that virtual malasadas that's right there on the corner table.
All right.
By the way, tell Melissa the cake was awesome. It was really good.
Okay, I will.
Oh my gosh.
She told me about that. All right.
Yeah.
Thank you.
Next time you come on, leave a virtual cake from the wife in the room. Okay. All right, John.
Yeah, but that's calorie free. So I will do
Calorie
that.
free, yeah, right on my diet. Got it. I'll have 2. 8:43. Wash your hands. Yeah, let's go to the KUAM News Zoom room where we have managed to fit an entire government agency.
Wow.
Into our KUAM News Zoom room. Bursting at the seams now because it's an independent GovGuam agency, the Guam Election Commission, where we have Miss Maria Pangilinan standing by, and you're going to kind of walk us through. Hi, Miss Maria.
Day.
Day.
We're here at the Guam Election Commission, 3rd floor office, getting ready to vote in office absentee voting.
All right, I'm so glad you're wearing your agate scarf this morning.
Represent. Even though she's from Jotnia.
I know. Well, Jotnia and agate's all like mixed. I don't know what's going on there. Anyway, thanks for joining us, Miss Maria. And so turnout, I know that when we spoke the other day, we've seen, about over 4,000 people cast ballots in the general election, right?
That's correct.
Okay, so we are getting people coming out to vote, but we definitely want more people to come out and vote. So you're going to show them how easy it is to let their voice be
That's
heard.
correct.
Okay, so let's get right into it, Miss Maria.
Yes. So all you have to do is bring your photo ID. And you can register and vote at the same time if you're not registered to vote yet. You come up to the elevator, come up on the elevator to the 3rd floor. Once you get off the elevator, you're going to come to the left and you're going to see our nice room here where it will direct you to to either appointments or walk-ins. We won't turn anybody away. You can walk in to register and vote at the same time. So once you get into the room, you will proceed to station 1, where they will process your application and prepare your application and your affidavit. So once you're here, you'll sit, and this is your application form. It should have been prepared when you call to make an appointment at 477-9791. You see, it's all filled out, including my birthday. Then, once I hand it to them, they will prepare the affidavit, and it's an affidavit envelope. This is what it looks like. You will sign it at the end of the process. By the way, one of the processes is to show your ID. They will ask me to pull my mask down to make sure who I am. All right? That would take, if you call, it would take only a couple minutes until you sign the log sheet. I won't sign today, but every voter will sign the log sheet. It's another way to account for all the ballots that are used during the day.
Miss Maria, before you leave there,
Yes,
Miss
ma'am.
Maria, I see the tennis ball on the left.
Oh, thank you. Thank you, Sabrina. To the left of me is the Assistive Technology Kit. Guam Legal Services Corporation is our partner. This kit is available to any voter. It includes the tennis ball so that if you have a shaky hand, you can use it to write. We have a poster that includes all the different tools that we have. And we even have signature cards that say, okay, if you're visually impaired, the signature cards will help you sign. And for those who are getting, younger in years almost, we have the magnifying sheet as well. All right?
All right.
And all this is displayed as you enter. The next thing we're going to do is go get our ballot. I'm going to show them what village I'm from, sample ballot at this time. And Mr. Kyle Camacho will explain the ballot to us.
Okay, so this is the partisan side. You're going to mark only 15 for the senators, 1 for the non-voting delegates to the House of Representatives, and then 1 for mayor. And you would vote 1 for vice mayor if you had one in your village. And then you can cross over for the senators. And then on the nonpartisan side, you have the option to vote for 1 public auditor, 2 for the Consolidated Commission on Utilities, 6 for the Guam Education Board. You can mark 1 answer for each of the judicial retention questions, and then you can take place in the straw poll if you want, and you can vote for whoever you want down there.
Thank you. I will now proceed to the voting booth. And here I will begin to vote. Just know that it's not 9 o'clock yet, so we can still video, we can still take pictures, but come 9 o'clock when the voters are in here, we will not allow you to take any pictures, especially of the ballot. When I finish voting, I will go to station 3. At station 3, before I left the voting booth, I should have, here's a ballot envelope, absolutely no indication as to whose ballot it is. I will insert the ballot in the ballot envelope, prepare to seal it, and at station 3, Michelle will seal both envelopes. Each envelope will be sealed, and it will look like this. Before it goes down to the precinct, my application will be attached to the back, and this will go down to the precinct with the list of all those in my precinct that voted absentee. So it will look like this. And they will tape it on. And the end of the process, because I'm the first voter today, they will show me, Michelle.
Yep, as you can see, it's empty.
Uh-huh.
I'm gonna lock it up for you.
And I will cast my ballot right in here. Okay, and the last thing is I will get my I voted sticker. And that's all it takes.
Good job. Easy.
So come call us at 477-9791. We will prepare your absentee ballot application form, and it will take only a few minutes to come up to the 3rd floor. And please be assured that we are doing everything to minimize COVID-19. Si Duas Masi from the Guam Election Commission.
Viva! Bota, Guam and Rota.
Good job, Maria. Even see your cameraman.
Thank you so much.
All right, take care.
You too.
Did you write me in? Rag. Okay, I guess that's a no. 8:51. Let's move on into the KUAM News Zoom room. Guys, we're getting Hospital Administrator Lilia Posadas on right after this for our COVID census update, as we did see a spike in hospitalizations from yesterday. That being said, let's move on to this next segment, which is going to be pretty cool, Bree.
Yes. We've got members from the American Red Cross to talk about Red Ball in a Box. We also have Marcus Fong's here, Monica Duenas, Chef Pepito Dixon.
Dizon from
right.
the Lotte
Dizon.
Hotel. Yeah, we've got Chef, of course, Chef Peter Duenas from Mescla and Chef Merkel. Forget about it. From the Hyatt Regency. Go ahead and unmute. Let's get right into it. And just like feel this.
Morning.
This is an interesting interview because normally when we do the Red Ball interview, we've got you guys in. Good morning, and there's like food everywhere. But what I do love is that with this new Red Ball in a box, we're definitely not letting COVID take the Red Ball from us this year. So, Marcus, we'll go ahead and get started with you. Let's talk about this Red Ball in a box. Whose great idea was this?
Well, Red Ball in a box. So, Red Ball has always been a signature event. This is actually our 20th year for Red Ball. So with all the social distancing and all the things that our community is facing, though, we still have the mission of the Red Cross to fundraise. And so as a committee, as a group, we had to get together and figure out what was the best way to be able to fulfill that mission, but at the same time, meet all the safety protocols. So Red Ball in the box, one of the things about Red Ball is always that great meal and that great gathering that we have together. Now, this year we got to minus the gathering part, but no reason why we couldn't all get together and still have a great meal. So that's how the idea of the Red Ball in a box was born.
It's great. Monica, let's take it over to you. Now, one of the great things about the Red Ball is that you get the courses out. Obviously the companionship and the company and, the gathering is great. But I really focus on the food. So how are you guys able to do this great food in a box and still keep that bougie Red Ball experience?
That actually is a question for the chefs because they are the experts and they are the ones who have created these lovely dishes. I mean, all three of their menus are absolutely mouth-watering. So it's really the chefs. They are the stars behind the meals.
Right, and it's so cool. Someone said the bougiest balutan ever for a great cause. I will go ahead and start with Chef Peter. I know you know a thing or two about balutan, so.
Morning.
Good morning, Chef. Good morning.
Well, I guess when the idea was prompted to us, we thought, wow, it's such a great idea. In light of the current situation, meals in a box is like the thing of the world now.
Right.
We're used to either ordering and eating in their cars or ordering and taking it home. But me personally, it's been very troublesome for us because we like to eat out. We like to sit in a restaurant and enjoy a meal that comes straight out of the kitchen.
Right.
And I thought these guys were genius because they put together this idea for a 4-course meal in a nice box, hand delivered by a delivery service, wearing bow ties and, making this unique experience. Taking the level of service to your doorstep is a great idea. And I'm sure there's gonna be a lot of folks copying the same concept for future fundraiser events because it's such a neat concept. But right after Red Ball, the MCA is gonna steal this idea. Sorry, Marcos.
He went there.
Yeah. I'm just putting it out there. I'm putting a disclaimer, but there's all these organizations trying to put together ideas on how to raise funds during this pandemic, and some of us, like with the Micronesian Chefs Association, it's having events is our thing, and the Red Ball is a massive event, and it's such a shame we can't have it this year. But like I said, it's such a great idea, bringing a 4-course meal to your doorstep, hand delivered, crafted by chefs. And I'm excited. I'm excited to to serve our customers or guests that are going to be supporting the Red Cross. And we're going to take a lot of pride in putting out the best food we can for this event.
So each chef is preparing their own, I guess, 4-course meal, right? And so people would have the opportunity to choose. Is this how it works?
Yes.
Mm-hmm. So Chef Peter, what are you preparing?
My dish is what I like to call a very simple dish, or simple dishes. I'm starting off with like a seafood dumpling, and I'm gonna serve that with a wasabi cream sauce and a soy citrus beurre blanc. And then for my salad course, I'm gonna do a warm kale salad with caramelized walnuts and some dried fruits. And then for the main course, it's going to be a surf and turf. I'm doing a pot roast braised short rib with a butter poached lobster tail, cold water lobster tail.
How big is this box?
That with some garlic mashed potatoes.
How big is this box, Chef? I mean, it's just like, are we talking about a container truck? Is that the box? Because
whoa.
Well, I'll let Marcos talk about that after I'm done with my dessert. But I'll tell you what, it's going to be an interesting box of food.
Right.
I'll tell you that much.
Yeah.
But I'm finishing my 4 courses with a warm melting chocolate souffle.
Right.
With creme anglaise and some fresh berries.
Nice, and we'll just go on down the line to Chef Pepito. What are we looking forward to from you with the Red Ball in the Box? What dishes you cooking up?
On my dishes, as Chef Peter, it's based on our experience, and through my experience, I can offer my specialty. I used to work around the world because I experienced working in a cruise line. For my starter, it's a Mediterranean dish. It's influenced Italian. It's seafood carpaccio on a bed of vegetable ratatouille with a berry sauce. And for my salad, it's a garden greens and combined with Florets Atlantic smoked salmon. And accompanied by candied macadamia nuts and dill herb vinaigrette. And for my main dish, because I'm born and raised in Philippines, it's like a twist of adobo, but it's kind of Asian style infused with the Asian barbecue sauce, and also a hint of my company is a Korean company. So it's almost like the traditional dish, like the galbijim. It's almost like a piece of Filipino, Asian, Korean twist, and accompanied with the broiled lobster tail. So it's gonna be a good dish. And for my dessert, it's a good timing that I have also. Back in PI, I experienced making the traditional mooncake. It's almost like the autumn festival for Chinese and Korean. For Korean, they call it Chuseok festival. It's a way of giving thanks for a good health, and for those farmer or something like in Korea. They like to exchange or take like a gift for a friend or a family. Then they join together to eat the sweets.
Nice, Chef Pepito. I think we lost Chef Mirko, but we're going to bring it back over to Monica and Marcus. My mouth is watering. I might have to change my mask.
Yeah, Chris.
I'm not sure what the CDC guidance is on drooling in your mask, but tell us, how do we get the tickets, guys? How do people actually get the Red Ball in a Box delivered?
Well, the Red Ball in the box is, so we're taking orders right now, and the orders are going to start, and they're going to be delivered over a course of a 3-week period. And each chef is going to have a week. So depending on which menu, which chef you choose, we'll schedule accordingly. Of course, it's on the first come, first serve. And the first deliveries are expected to start October 20th and run their course into November 6th, weekdays only. And you can order it through our social media sites. We've got Red Ball Guam on Facebook, Red Ball Guam on Instagram, and we've got some contact information, some phone numbers that you can call to get those orders in.
And maybe
Plus, you can also contact any one of our board members as well. They'll be able to help you out with that. Hi, Bree.
Hi, Juan. I just wanted to also just give you guys the opportunity just to, explain how important it is and the work that you guys do over at the Red Cross.
Well, when we were thinking about this, we knew that this was a sensitive time, and there was actually a lot of discussion between the board and the rest of the group on how we could best do this. As I said earlier, we still have to fulfill that mission. And as a matter of fact, the inclement weather over the past couple of weeks have actually activated our volunteers. But you know what? Our staff and our volunteers have changed the way they work, but they haven't stopped their work. As a matter of fact, in the month of August and September, we responded to 38 flood victims across the island because of the heavy rains. And of course, our volunteers had to social distance, they have their PPEs, but the work doesn't stop. And so I wanted to make sure that we had an opportunity to continue to fundraise for them. And as the typhoon season ramps up and the things that are coming down, we need to be prepared. In any emergency, in the midst of an emergency or after the aftermath, we always ask ourselves, what more could we have done? And I think we have an opportunity now to support the Red Cross and answer that question before anything happens. So I think this is an opportunity for us to, in our small way, be able to help out and enjoy a nice meal while at it.
Right. Enjoy a few boxes of some really awesome, great meals. Want to thank you guys for coming on. And Monica, let's get you guys on a little bit closer to when you're going to start the delivery, and we'll do another push for Red Ball in a Box. I think it's great. One of the COVID silver linings, it's a gray sky time, but anytime you got gray skies, there's always silver lining. It's the way we snatch what could be defeat from the claws of COVID, and we come up with something bigger, something, in some ways better. You're going to reach a lot of people with this Red Ball in a Box. So props to the board, and this is a great thing, and we really want to, of course, get you guys on again to promote as we get closer to rolling out those Red Balls in the Box.
Yes, thank you, Chris and Bree. Thanks so much for having us. We are really excited about this fundraiser. It's totally new grounds for everyone. No one's ever done anything like this before. So we're really excited about it. The chefs are excited, and in light of everything that's happening, we are looking forward to still supporting the Red Cross and enjoying delicious meals at the same time.
Thank you, Monica.
All right, thank you, guys.
Thank you, Marcus. Chef Peter, let me know if you need Chef Pepito, let me know if you guys need a taster. There's a rumor going around that I was on a diet, but, totally false. Okay.
Just give me a call. We'll make extra for you, Chris.
There you go.
You up to that, Chef Pete.
Yeah, you go. Cut out the middleman.
All right, take care.
Thank you, guys. Thank you. We'll see you again.
Thank
There you
you.
go. Red Ball in a Box.
Right, you go to their Facebook page, Red Ball Guam, for more information. The orders start October 19th through November 6th. Courtesy Delivery Heroes at Buen Provecho. You can call 688-0283 or 688-0280.
There you go. We're okay, now we're ready to go with Lillian. We're just right there with our KUAM News Decision 2020 candidate interviews. But, of course, in the midst of a pandemic, we're seeing an increase in the number of positives. The deaths keep coming. So we want to make sure that COVID is a big part of our conversation every morning. That being said, Lillian, thank you so much for coming on and blessing us with your time.
Yep.
We'll just get right into it. The COVID census, we saw a big spike in admissions yesterday. Unmute.
Yes, the numbers are rising. As of this morning, it is 44. We have 44 individuals in the house with COVID infection. And of the 44, 15 of them are at the ICU level of care. And of the 15, 7 of them are on ventilator support. So that's where we stand right now with our COVID statistics in the house as of today.
Lillian, it seems like just the other day you were reporting hospitalizations under 30. What happened, and can you give us any more info on the traffic that's come into the hospital?
Just that they continue to come in, individuals, I don't know if they were tested positive, part of that population that, public health, the JIC releases at the numbers, or that they just come in with symptoms, and then when they are tested in the emergency room, the results are coming out positive. So
Right,
that's what's happening. They're coming in.
Right, and I remember what you said when we spoke to you last, when the number was, I think, 82 or something over the weekend, and you said you guys got to prepare because there's a probability that almost 10 or something like that, 10 or 20% would make their
10,
way
20%, right, 10
would
to
make their
20%
way
would come.
over to GMH.
Yeah. Uh-huh.
Can you give us?
So-
Oh, good. Go ahead.
Well, we're just again seeing the numbers, people coming in with the infection.
Can you give us any additional info on the COVID-related fatalities that we've had since the last time we talked to you?
No, I mean, other than what's already shared and published in the JIC, really, there's not much any more information that, that I can release, so I don't have any more other than, what's published already in the JIC.
Right.
And, these are essential information that, the community needs to know.
Lillian,
That we continue to use.
with the admissions, can you give us maybe our patients coming in? Because I know we've been talking over the last few weeks where you were saying that a lot of people are waiting too long to go to the hospital.
Not so much that they are waiting too long, but we're seeing that, they've had the symptoms for several days. And so, or even a week. Some of them think that they're just going through the flu symptoms. So yeah, when they wait, when they delay getting treatment right away, it affects their whole system and how they can recover. So, again, I'm just going to encourage people, continue wearing your mask, because it does show that when you don't wear your mask, this virus is airborne, and it can last minutes to hours in the air. So that's where it gets transmitted. So people, please continue to wear your mask. And not wait too long. When you start feeling the symptoms, get medical treatment at a clinic or a public health clinic, or where you can get, where you normally have your primary doctor, where you normally get seen. Be seen as soon as you can.
Lillian, I just wanted to ask you about how your staff is doing their health. I think I read a headline somewhere about 60 GMH employees. Is that correct?
It was 60 total number of staff who tested positive, but majority of them have recovered and have returned back to work. So yes, that was the number that's the latest, was about 60 total staff that tested positive. Yes.
And that's since the beginning of the pandemic, correct?
Second wave.
Right. Yeah. So you have been giving us those updates. So
Yeah.
I appreciate that. Lillian, the statement just came out from the governor's office. It was about 3 paragraphs worth of statements. I'm just going to read you the relevant part. The governor has been clear that our policies will be directly linked to the data we have. She's especially concerned about the increase in new cases, the increase in hospitalizations, and the increase in COVID-related deaths. For these reasons, she will not be lifting any additional restrictions this week, and the island will remain in PCOR 1 with a safer at home advisory. Just as the head of the hospital, like you said, we're seeing the numbers climb. This is an area of concern. Do you think that the not lifting any more restrictions will give you guys a little bit more breathing room? And are you anticipating an even further surge in admissions and ICU level care for people with COVID?
Again, it's not really because, we don't want people to come to the hospital, but the restrictions that the governor is continually enforcing, it's really for the whole community. It's for the protection of the whole community and to really minimize as much as possible the transmission of this infection. And so, but the hospital is here. Whoever needs to come and be seen, we are here and we will accommodate you. But it's really for the general public, for the protection of the general public, that the governor continues to, encourage and minimize, the possibility of spreading the infection by, again, enforcing social distancing and, people wearing their masks, minimizing the possibility of people congregating. And, that's really the goal, is just to try and minimize this spread of infection, the transmission of this infection.
Right, yeah. It's just that she had mentioned the increase in hospitalizations as one of the factors, right, and not easing restrictions.
Okay. All righty.
Okay. No, I can call her for updates on that
Okay.
stuff. 'cause-
Thank you so much, Lillian.
Thank you.
Appreciate your
Take
time
good
this morning.
care.
You,
Stay safe.
you too.
Thank
Okay,
you.
there's some
Take good
virtual empanada if you want to get some on your way out.
Oh, I like that, and the lobster that Chef Peter Drain.
I know, right? So that was your
Yeah.
stomach growling, I heard.
I'll just take it and eat it at home with my husband.
Go ahead,
There you
Balutan
go.
to go. All right. Thank you, Lillian.
Alrighty.
Esther.
Bye.
9:14, take a short break. We're coming back with KUAM News Decision 2020 next on The Link.
Win the Galaxy and more.
GU Self-Storage, conveniently located near the Harmon McDonald's. We offer affordable rates, online payments, and auto bill pay for your convenience. Plus gate access daily from 6 a.m. to 9 p.m. Call us today at 648-7867 for more information.
Celebrate National Pizza Month with a Pepsi Pizza Report. Pepsi helps celebrate this tasty month with an easy way for you to win Pepsi and pizza. Post a photo of yourself enjoying your favorite Pepsi beverage to KUAM News, Uno Instagram, or Facebook pages to enter to win Pepsi and pizza from one of 10 pizza sponsors. Catch the Pepsi Pizza Report every Thursday on KUAM News The Link Morning Show and on the social media pages of KUAM News for reports, tastings, and everything pizza and Pepsi.
Your generosity can change lives. Disasters won't stop during this global pandemic, so neither will we. The Guam chapter of the American Red Cross is calling on the continued support of the community to assist with their mission of providing disaster relief and recovery efforts, military family support, and life-saving training and certifications. In times of emergency, our support will not waver, and we pray that your support of our efforts will continue as well. We invite you to join us in commemorating our 20th annual signature fundraiser virtually this year by supporting the Red Ball in a Box. We will be delivering special red boxes, which include a 4-course dinner from Micronesian Chefs Association and wine to our patrons and sponsors. As a sponsor, your company and message will also be featured in a special television tribute to the Guam chapter of the American Red Cross. For sponsorship opportunities and more information, please call 688-0280 or visit our Instagram or Facebook page. Let's support our community. Though we're apart, we're still together in generosity and support.
Pepsi Guam Bottling, a local company. We produce your favorite products right here on island, like Pepsi, Mountain Dew, Hanum, Chamorro Punch, Tropical Ice, and more. We've invested millions into local production and will continue to upgrade our facilities and provide local jobs so you can truly buy local. Our long history of producing the freshest and best products will continue. This is our vision. Pepsi Guam Bottling.
We got your 6.
At 6 a.m. with The Link on Breeze 93.9 FM. Bree and I connect you with all the latest news and information
What are the
you need to know to start your day.
Then check back with Guam's news leader at 6 p.m. for the day's top headlines with KUAM News Primetime.
From 6 a.m. to 6 p.m. and everything else in between with KUAM Digital, we got your 6. 9:20. Let's get into it. Our K-Wave News Decision 2020 candidate interviews. Good morning. And we have this morning Democrat candidate for Senator John Ananich, and then we have the minority leader, incumbent Republican Senator Tello Taitigui. Good morning.
Good morning.
Good morning, Sabrina.
Hi.
Good morning, Sabrina. Good morning, Chris. Good morning, Guam.
Good morning, John.
Good morning.
Good morning.
Let's
Good
go.
morning, sir.
We're gonna discuss the rules of engagement here, guys. There's no kicking, biting, hair pulling.
No gouging of the eyes.
Yeah. I think those rules need to go to Tello. I'm okay.
Tello will gut you.
No, hey, John, we both own bars in our lifetime, man. So there's no holds bar.
I like that. No holds bar. All right, here we go.
No holds bar.
So the format, Bree, if you could apprise the guests of our format for this segment.
All right, so you guys get 1 minute for your introduction, your opening statement, and then we'll proceed with the questions, and you'll have 2-minute responses. Chris will cut you off if you exceed that time limit, and then you have a 2-minute closing statement to give your final pitch to our listeners and streamers on why they should vote for you. All right.
Great.
Let's get right into it. Opening statements. We'll go with ladies first. Minority Leader Senator Tello Taitigui. 1 minute for your open, and your time begins. Hold on, because stopwatch. I do this for a living, guys. Your time begins now, Senator.
Thank you, Chris, and thank you, Sabrina. Hafaday Guam, I'm Tello Taitigui. I'm originally from the beautiful village of Inalahan, Southern girl at heart, and now I'm currently residing in the beautiful village of Timuning. I was a former director of the Women's Bureau, a deputy general manager of the Guam Visitors Bureau. I was a small business owner and currently a senator in the 35th Guam legislature. And for fun, I greatly enjoy listening to music, particularly with my dad and his collection of jazz music. He's a musician as well. I'm running for re-election to serve in the 36th Guam legislature, not only because I would like to continue the work I've started, but I think people of Guam want someone, who's not afraid to ask the hard questions or to call out those who lost the people's trust and demand for transparency and accountability. I believe I've proven to be that person.
Thank you, Senator.
You count on. Thank you.
John?
John, your time starts now. You have 1 minute.
All right, great. Half a day, and I'll try to make this real fast. First and foremost, I'd like to thank you, Chris, and you, Sabrina, and KUAM and the link for allowing this to happen. The new landscape of campaign has made it so difficult for new candidates to get the message out there. It's made it really, really hard. For those who don't know me, I'm John Paris Ogden Ananich, and I'm a former police officer, a combat veteran, and currently a small business owner. And I'm running because crime seems to be it's running rampant on Guam, and criminals seem to get a free pass, and I think that needs to change. No more slaps on the wrist for violent criminals, and no more plea deals for sexual predators. We need to change that. We need to make Guam safe again, and we need to ensure that our people are safe, and not only believing that they are, but that we ensure that we bring fear back into the criminal, as opposed to the community being scared of the criminal enterprise.
Thank you, John.
Thanks, John. I wanted to ask, and Tello, you kind of mentioned a little bit about trust. Some people have lost trust in our elected leaders over the past several months, and that includes the Guam legislature. What do you plan to do if you're reelected, and John, if you're elected, to restore trust? And we'll start with you, John.
John, you have 2 minutes starting now.
Okay, well, I think the trust issue actually goes into this pandemic that we're in right now. We all know that this virus, this corona virus, has affected everybody, and it's proven its ability to take lives. And the trust issue right now is we have a divide because of this pandemic. There's a huge divide. There's people that believe it's nothing more than a common flu, and then there's people that also believe that it's a lot worse than that. And I think the trust issue has to do with the leadership. And basically, the first month that it came out, I understand. We locked down and we try to figure out what's going on till the data comes in. But we've opened up, and we semi-locked down, and and basically, I think the people right now just don't understand what's going on. I mean, if we are gonna truly stop this virus, then we need to do a complete lockdown and get it over with, and pretty much identify where the problem is. But where we're at right now, it's almost where we cannot do a complete lockdown. We need to find out how to coexist and work with it. So there's a huge trust issue, because it's just I don't think the people feel that this has been handled correctly. So this pandemic has caused a divide, and we need to come together as one people to figure this out. If we're going to do a lockdown, then let's lockdown completely. If we're going to open and coexist, then let's come together and become creative on ideas how to coexist, and also provide that safety and that stability for our most vulnerable. But we need to figure that out, because I think the time of a complete lockdown has already passed because of what's been going on. And I think the people right now have no idea. What are we doing? Are we trying to handle this pandemic and control this pandemic, or are we trying to open up?
Thank you, John. Senator, you have 2 minutes to respond, starting now.
I think as far as transparency, that's the key right here. If we want to gain the trust of the people, we need to engage them in everything that we do. Oversight hearings on agencies that are doing not a good job, and asking the hard questions. We need to open it up to allow for not just oversights, but to ask questions during oversights and not be muzzled during an oversight. Things like that. I mean, if you don't have the opportunity to question somebody's character, or especially if somebody is holding $10 million worth of over $10 million of federal funds, we need to be able to ask the hard questions. And that's what I'll do. Continue. I've been doing it, trying to keep the administration on their toes with regards to how they're spending federal funding, and ensuring that the public hears what we have to say as well as the administration. So I think the key word is engaging the community with transparency and let them know what is going on, both on all levels, on the local level, the federal level, all levels. Keep them engaged.
Thank you, Senator.
The governor was given $117 million in CARES Act funding. Although the legislature can't necessarily appropriate federal funding, there is precedence, though, with Senator Amanda Shelton's Zuday Mangafa bill, which eventually became law, in which she managed to, designate that $10 million of the CARES Act funding go to that program. So if you had the ability to appropriate $117 million, where would you appropriate it to?
Well, there's two areas I think that's really important, and that's rebuilding our economy. And I think that PUA has provided to many of the employees who are out of a job, the 80,000 individuals who are out of job. But I think what we need to do is start to rebuild our economy, and that is assisting the businesses out there who've closed, and they're having a difficult time. They need a break. So I would take some of that funding and use it for businesses to keep them up and running, to hold on a little bit longer here. I would use that. Then I would use the money to buy a facility, not a facility, but an apartment building for the homeless, and not just keep putting them from one place. And then if that individual place is not, it's on a lease-to-lease basis. In other words, I'd like to find something more permanent. We've had the opportunity to see what it's like to house individuals in Mighty. Now it's an opportunity for us to purchase, and I know of some apartment buildings that are for sale. This would be a great opportunity to purchase one using this CARES Act money and putting those individuals who are homeless in there, at the same time helping them find a career, training them for a job. So those are the two areas I would like to see that money put into.
Thank you, Senator. John, you have 2 minutes to respond, starting now.
All right. Well, thank you, Sabrina, for that question. Thank you, Chris. That's 17 million. That's one aspect of the CARES Act we're talking about. But there's a lot of unspent money on the CARES Act that most definitely I share the same sentiments with Senator Tello that we need to jumpstart our business community and get our economy working again. But with regards to that, especially the homeless, there's a lot of organizations that I've been looking into that they actually have a tiny home community for the homeless where they bring in the homeless and they deal with the issues. And I think that, that's something that's very affordable for Guam. We can do it with the remaining CARES Act funds that we have right now. The tiny home community, it doesn't only address the homeless, the people that don't have shelter, but it addresses them also with their the needs for with their drug addiction and other reasons why they're homeless. Because homelessness is not necessarily just because you're sheltered, or you don't have a shelter. There's a lot of other aspects involved. So I think we need to get that money, and first and foremost, I think we need to jumpstart our economy, get our economy back up and running, and then deal with the homeless issue, and not a temporary type of motel thing, but maybe a government and private sector partnership to work together to do maybe even a tiny home community, so that we can bring in the homeless and get the people that maybe they just need a place to shelter so that they can get back on their feet. Put them into work programs, help them with their addiction. Whatever it is that the reason why they're homeless, we can address it if we just build this community that addresses those homeless needs. So there's a lot more money than 17 million out there that, especially with the CARES Act, that we can probably look into and grab and address those issues. But first and foremost, we need to get our economy back up. We need to get these businesses back open because it's definitely very detrimental.
Thank you, John. Thank you.
Oh, okay. All right. Thank you. Okay.
We'll move on to the next question here. During the Leon Guerrero Tenorio campaign, much was made about their desire to reestablish the Ethics Commission. However, after nearly 2 years in office, that commission has yet to be funded or stood up and remains inoperational. What would you do if reelected or elected to improve the public's ability to report instances of ethical violations to the appropriate people? Senator Tello, you have 2 minutes to respond, starting now.
I was thinking about that when it was in the budget bill and the money that was appropriated for that. And I thought it's kind of funny that you've got the fox guarding the hen house, here when it comes to ethics. I mean, how are you going to provide these certain complaints to individuals who've been appointed by the governor? It makes it very difficult, and I think it's kind of unfair. I think we should revisit the ethics board and how it's comprised, and bring people there who have no invested interest in the administration or the legislature or anybody in politics or government, especially not in government. I think this really needs to be revisited on the ethics. So I look forward to doing that in the 36th Guam legislature to see the composition and to make it fair.
Thank you, Senator. John, you have 2 minutes to respond, starting now.
Chris, can you repeat that question? I didn't really catch it. Can you repeat it real quick, please?
Guam Ethics Commission, during the campaign, Leon Guerrero Tenorio administration, they made a big deal about getting this commission up and running. However, after nearly 2 years in office, it's not up and running. So if elected as a senator, what would you do to improve the public's ability to report ethical violations to the people that need to they need to report it to?
Well, apparently, since it's an initiative that they talked about that isn't up and running, the first thing I do as a senator is have a public hearing and get the subject matter experts inside, involved, and on how we can put this together. If it's something that they ran on that is still not that they haven't put it to fruition, then maybe we need more, not only to revisit it but bring it to light. Let's hold a public hearing. Let's have a public hearing and get the subject matter experts involved, so that we can make a decision and an educated decision when you bring the people that know how to handle this situation. So if it hasn't gone into fruition, I think it's something that we need to get the public involved.
Thank you, John. Bree?
Okay, we don't know what's going to happen next year in in terms of funding for the government, let's just say. If you had to make decisions on where cuts should be made within the government, where would you cut?
Please be specific.
Yeah.
And you have 2 minutes to respond starting now. Who's going to answer?
We'll start with John.
John, you have 2 minutes starting now.
Okay, I'm having a hard time hearing you guys. It keeps breaking up. So you're saying if we had to cut, where would we cut in the government?
Right.
Okay, right now, Bree and Chris, I think cutting employment right now is only going to be a lot more detrimental to our economy. We already have 40,000 people unemployed. To cut in the government, it's not going to help the situation. What we need to do is we need to find ways and become very creative on reopening our economy. Right now, I don't think we should be looking at putting more people unemployed. We need to look at getting more people, more people back at work, because the fact of the matter is we're not going to really feel what happened with this pandemic till next year or maybe 2 years from now, because the collection that the government believes that they're going to get, they're not going to get because of this lockdown. So I don't think we should be looking at how to cut more people from working, and it'll only hurt our economy a little bit more. We need to look at how to get these 40,000 people employed. So I don't think cutting is an issue right now. It's only going to hurt us more than it's going to help us.
Mm-hmm.
Thank you, John. Senator Tello, you have 2 minutes to respond to the question starting now.
Thank you, Chris and Sabrina. The future is going to dictate our economy, and it's going to be very difficult. So as time goes on, I think we're going to have to adjust if the revenues are not coming in as predicted in this budget bill. But I think just because we budgeted a certain amount of money doesn't mean that we should start saving or making cuts. And I think these cuts can be done by merging consolidated agencies into one and sharing resources with each others. I think, of course, no new positions hired at this time. We look at public-private partnerships, to veer away from certain things that the government does on a day-to-day basis, like services in facilities like Parks and Rec. There's quite a bit of area in Parks and Rec that we can outsource on there. But I think, as we move forward every month, it's like the government of Guam should treat this as a paycheck to paycheck. That's what the people in our community are doing, paycheck to paycheck. So we should do the same thing. And if there are areas that we need to cut, we have to make those hard decisions. But I think if we could just build our economy, like John says, we need to build our economy and get it rolling back. But it doesn't mean just because we're building our economy that we have to spend all the money, the government has to spend it. We have to learn to save and live within our means, most especially. Live within our means.
Thank you, Senator. Next question. Name 3 figures from Guam history or current times that inspire your political views. And we'll go ahead and start with Senator Tello. You have 2 minutes to respond to the question starting now.
3 people in history. Okay, well, I know my Republican Party probably will not like me for this, but, Ben Pangilinan, we were friends before he was a senator, before I was, but he was very inspirational to me, Ben was. Tony Ampinco, on the soft side of, just taking it with a grain of sand. And the third person, do they have to be political? No, right? It could be. Yeah. Thank goodness. Okay. It's not a whole long list on that one, but no. And by the way, with Senator Ben Pangilinan, I was in the 30th Guam legislature. I had the opportunity to serve with him. And he had such great insight and love for the people of Guam. And that's what instilled in me to love our people and care for them. So, and the last one would probably be my dad, unconditional love. He taught me unconditional love.
Thank you, Senator. Thank you. John, you have 3 minutes to respond to the question starting now. Or 2 minutes, sorry.
Okay, I thought you were giving me an extra minute there, Chris.
No fair.
Yeah.
But anyway, I actually come from a family of politics, even though I've shied away from it for a long time. I would probably have to go with my Cadensu family. The Perez Ogden is the Cadensu Macaca, and Ken Perez was a senator, in our family, and then after him was Senator John Perez Ogden, who everybody knows was definitely a consensus builder and brought everybody together when he got into the legislature. Because we need to understand that when we get in, it doesn't matter if you're a Democrat or Republican. Especially right now, we have definitely got to work for the people. And when we have to make sure that what we do is for everybody. And then probably the third one would I would have to say maybe Gutierrez, Governor Carl Gutierrez. I really when I was growing up, I followed him, and he was definitely a governor for the people, and he took care of the people. So if I would have to stay within the family and just say that Ken Perez, my uncle John Perez Ogden, and Carl Gutierrez, they really showed that they're not only consensus builders, but they're people that can get into a legislature regardless of minority or regardless of what the numbers are, and work together and make the people make it so that the vote is not for a few, but for the majority, for all of Guam.
Thank you, John. Sabrina?
You both mentioned the economy repeatedly, so I wanted to give you the opportunity to explain more specifically and in more detail in 2 minutes, what are your ideas to rebuild the economy, to diversify the economy? And we'll start with you, John.
Yeah, as much as we would like to, diversify the economy and bring other businesses to Guam and help out, I think there's two aspects on Guam or two entities that we really haven't taken advantage of, and that's the agriculture and aquaculture on Guam. What we need to do is, first and foremost, is we need to open. We know that we run on a bipod, which is tourism and the military, federal funds. And I don't know any visitor that will come to Guam, especially if Guam's not even open to its own people. But the two places would be agriculture and aquaculture, and we need to develop it, especially in the aquaculture part, because we actually have a facility. If we invest in it, we can actually do our very first export out of Guam. But it's something we need to look at. Somebody had a great idea to do it, but then it never followed through. And then we also have the cannabis industry. We have a cannabis industry that it started off with medical, but there was no plan. There was never any legislation or anything to show how to do it. And now we have it at recreational. So we have three industries right now that can boost after our economy opens up, that we can actually look into to create more revenue, and that would be the agriculture, the aquaculture, and our cannabis industry. We know we allowed it to be legal, but then that's all we did. We need to set it up. We need to take all the everything we can do to ensure that we profit from it and make it beneficial to us. So there's three industries that aren't really promoted that were set up, and that's the agriculture, aquaculture, and cannabis. I believe that if we can open our community first, allow our businesses to open first, those are three areas that we can focus on and help our economy.
Senator Tadigui?
Thank you, John. Senator Tello, you have 2 minutes starting now.
Okay, actually, this could take a long time, because we'll start from the beginning as with regards to it's time to start funding programs to train outside of tourism. We need to retrain our workers in areas as farming, aquaculture, construction, healthcare, teachers, IT. These are areas that we can train, and we need to provide funding for GCC and Guam Contractors Association to help this. So we go in that direction for now. We start training, we start building in those other areas. I worked at the very beginning with on submarine cables. I've introduced legislation to create a task force on submarine cables. We have many cables coming into Guam, and even today they're building in PD another facility that boosts cables going through Guam. And this is an economy that's friendly, environmentally friendly, because I think if we're going to build any kind of new economy, we have to be conscious of our environment at the same time. Also to be sustainable. So we look at biodegradable, recycling, refurbishing, areas such as this, because we're going to have a difficult time sending out our trash to anywhere else. We're going to have to deal with it right on Guam. So the area of rebuilding on our workforce industry to other areas other than tourism is a start, and then start encouraging and providing incentives to areas in these areas such as farming, IT, construction, teachers, and most especially healthcare.
Thanks, Senator Taitigui. One thing that the pandemic has kind of raised awareness about is the need for better mental health care for our island. And I know that during Suicide Prevention Awareness Month, there had been talk about how the numbers had risen, but suicide has been an epidemic on Guam for years now. And so I just want to hear, what are your ideas? What are your plans to improve mental health care for island residents? We'll start with you, Senator Taitigui.
Suicide has touched many of our families, and it has touched my family. I had a first cousin who passed away a couple years ago, and it was very difficult and hard to understand why. It's always the question, why? Did we see the signs? Is there enough programs out in our community to help individuals to do that? I think, Guam Behavioral Wellness is doing a great job. All the initiative, Teresa Areola out there is really, banging on doors and getting things done, providing all the numbers to call. But I think the government has an opportunity to assist nonprofit organizations. This is a great aspect. Sometimes the government can't do everything or can't do it as well, especially when you're coming under something so sensitive as suicide. And I think that the government needs to provide more assistance to nonprofits so that they can help those in the community. We continue to make it bring awareness about suicide, seeing the signs of an individual, educating our community to reach out to somebody, but definitely, giving them that direction, that path to go down if you're hurting in any way or have concerns. So it's supporting something very important. And yes, you're right, Sabrina, this has been happening way before a pandemic, and it's gotten worse since this pandemic. Thank you.
Thank you, Senator. John, you have 2 minutes to respond to the question starting now.
All right, thank you, Sabrina, for that question, and thank you, Chris. Suicide is Guam is such a small knit community. I'm pretty sure that everybody on Guam has a friend or a family member that has taken their life. As a combat veteran, it happens so often. I think it's every month I hear that somebody I served with in Afghanistan or somebody in my own platoon, took their life. But we hear it all the time, and it's very apparent. And I hate to be as a matter of fact, but what we need to do is fund it. When we talk about it, everyone brings up the issue about suicide, but nobody funds it. We need to fund the outreach programs. We need to stop talking and start doing. If we fund mental health and we fund these organizations, then that's the only way we're going to stop it. They're working on such a tight-knit budget, and I'm pretty sure the budget was cut again. So in order to help these individuals, especially individuals that need help, and as a combat veteran, we understand that our veterans also are going through some hard times. there's no funding and there's no programs for them. So let's stop talking about it, and let's, as a matter of fact, let's just fund it. Let's give money to where it needs to be, and then let's fund it so that they can do these outreach programs and get out there and hire more people to actually campaign against it and give the people help that need help. Thank you.
Thank you, John. Next question. Lord knows we've seen no shortage of disagreements, fighting, pettiness between the legislature, the executive branch, and even the congressional delegate office. So if re-elected or if elected, what would you do to foster better, more thorough, and more transparent working relationships between the legislature, the governor, and the delegate? You have 2 minutes to respond. We'll go ahead and start with you, John, starting now.
Yes, this. We've seen it, and this is not only a problem that's happening on Guam. We see it nationwide. That there's a divide, and this pandemic has caused even more of a divide. And what we need to do is we need to we need to elect officials that are going to be consensus builders. Like I mentioned before with Senator John Perez Ogden, that's what he was able to do. We need to come in and be consensus builders and work together. We're facing a pandemic. It's unprecedented. This is a time now that and it's not humble times. And it's a time that needs senators to get in there and work together. Because at the end of the day, this is not about a party affiliation. This is about the people. So we need to come together, everybody come together and make those hard decisions, like Tello had mentioned earlier, but make those decisions not for a certain few, but for everybody. So we need consensus builders in there. We need people that, at the end of the day, Chris, this, that, once elected and, God willing, and with the confidence of the people, I get a seat. It's not about party affiliation. It's about doing what's right for everybody. So that's what we need to do. We all need to come together. We all need to realize that we're fighting a virus as one people, not as party affiliation. So we just need to get people elected in there that are willing to work together. And we've seen that. We've seen the divide. So hopefully on the 36th, with God's grace and the confidence of the people, I'm allowed to sit in there, and I plan to go in there and be a consensus builder and bring everybody together so that we work together for the common good of everybody, not just a few. Thank you, Chris.
Thank you, John. Senator, you have 2 minutes to respond to the question starting now.
That's a perfect world if we could do that. But there are people who won't agree with what your views are or your perspectives. And that's probably, we have to really put in perspective. You should agree to disagree. At least you could have that perspective. But I think, the most important thing is if we're transparent and open and we do things based on what's right for the people and not because it's a political correctness, then I think things will get along a lot better. But transparency is key, most of all. And I think if we just have that transparency, people can make that judgment on their own, whether this particular senator or political leader or, is making the right decision based on what's best for the community, and let it at that. But agree to disagree, and be fair. I think a lot of the arguments happen because the lack of transparency and the lack of fairness for everyone, treating everyone fair. That's when you're coming to trouble. At least my trouble.
Thank you, Senator.
If you're not fair, then I'll bring it up.
Okay, next question. What letter grade from A to F would you give the Leon Guerrero Tenorio's administration's handling of the COVID-19 pandemic? We'll go ahead and start with John. You have 2 minutes. Go ahead.
Well, Chris, thank you for that question. You kind of put me on the spot there, but thank you very much. I'll actually give the very first the first month of this pandemic, I'll give them an A. I would give them an A because they did what they had to do and they locked this down and they needed more data to find out what's going on. And I don't feel that anybody who's in a leadership position deserves anything less than a C. So I would give them a C right now with how they're handling the economy right now. Because if you were going to do a lockdown, then lock it down, complete lockdown. If you really want to control this virus, because we know that this COVID-19, it needs a host to survive. So when you have a lockdown that's still kind of open, I mean it's almost an open lockdown. It's just kind of like an oxymoron, right? So if you're gonna lock it down, then lock it down. If we're gonna do 2 weeks, then do 2 weeks across the board, a hard lockdown. Don't have a lockdown, but be selective on who's allowed to open and operate. Because if you're gonna do that, then let's open up and let's become creative to coexist. So I would give them an A in the beginning. And I'll give them a C right now because with the information and the way that they're doing this new PCOR 1.5. I mean, I have no idea, but if you're gonna lock down, Chris and Bree, then lock it down. If you really want to control it and do contact tracing, then the only way to do it is to do a complete lockdown. But I think we're beyond that. We need to figure out now how we need to coexist. We need to instead of only losing lives, and then that it's terrible to say that, but we're losing livelihoods as well because of the way it's happened. So I give them an A and a C, Chris. Thank you.
Thank you, John. Senator, what letter grade would you give the Leon Guerrero Tenorio administration's handling of the COVID-19 pandemic? 2 minutes starts now.
I really like how John put this in perspective. Grade them at the beginning and then grade them at the end. That was a good way to start. That's good because, I think it changed on the way, down the line. I don't think an A, I would give them an A, definitely. I mean, I don't think anybody got an A, not even any countries or states should have gotten an A. It's unprecedented what happened and how people are dealing with it. And I think there was a lot of stumbling in the dark on this. But I think at the beginning, I would probably give them a, B minus, for it. But, and that B is because they're trying and you saw them trying. But then as time went by, it just, we weren't getting information. Our questions weren't being answered. Everybody was left in the dark. We had to screen to ask for what's going on. What are they planning on doing? And that's, I believe, the time when, and I think the media, because it was the media that was pushing to get these answers out. And then she came on with her press briefings that were coming on. I think, was it almost daily or weekly? Because now it's been so long that she's had her press briefings and it's sparingly that it stopped. So that B went down to a C, and then when she stopped these press releases, not press releases, but conferences, video Zoom conferences. I think John, I think the C2 went down, but I have to do kind of like a C minus on that one too, because still up to this day, a lot of things have not been put in place. We've been in this for 6 months. You would think, by that time. And let's not forget, before this pandemic happened, we had a summit that was at Pacific Star.
Thank you, Senator.
3-day summit.
Thank you, Senator.
What has happened?
Thank you.
Thank you.
That summit was for the pandemic response plan.
Yeah, that was for the pandemic response plan that they never, it's in a filing cabinet somewhere.
Exactly, yeah.
Brief?
Well, we are running out of time. We only have 4 minutes left. So I'll save my question for the next candidates that come on tomorrow.
Are you sure?
Yeah.
Yeah, then we could do 4 minutes overtime. Are you guys?
Yeah.
Yeah, I feel like if it's a good one, yeah. Of course.
I wanted to ask about education, right? 3 priorities we always hear: education, healthcare, and public safety. But what we always also hear is cuts to the Guam Department of Education. And so we've had them on periodically, and they're facing a $15 million cut, from what I understand, just for this current fiscal year. And I guess over a period of time, it's been like $30 million, I want to say. That's what Mark Mangiola had told us. We also hear about Simon Sanchez High School. It hasn't been rebuilt. If you are elected, re-elected, what will you do to fully fund the Guam Department of Education to the point where we would actually meet the adequate Public Education Act?
You have 2 minutes to respond now. We'll go ahead and start with John.
We're starting with me?
Yeah.
Yeah. Well, you know what? As a matter of fact, being I lived in Jigo for a while, and Simon Sanchez, definitely we need to rebuild Simon Sanchez. We need to make sure that we fund that somehow. Through public safety, my platform is public safety, and there's a lot of ways with public safety that we can actually implement some funding into building a new Simon Sanchez. And I also believe that crime prevention through education is number one. But I hate to say this as a matter of fact, also is funding. We got to find it. As an individual, I never walked out of my house, Chris or Bree, and found a bag of cash, just sitting outside. We need to get to work. We need to go and find it. There's money out there. There's programs out there, and I'm pretty sure that if we just go to work and work hard, we can find funding, to start a new school. But most definitely, Simon Sanchez is, out of all the schools on Guam, that is one that needs to be rebuilt. And I have some plans on how to create some funding through public safety for education. And I believe that we have it on my website. I believe we brought it up today. You can probably go and look at it at johnananich.com and see how we're going to integrate public safety and help education. But again, we just need to fund it, and we need to. If we don't have the funds, then we got to go and get it. Let's work. Let's go find it, and then let's figure out how to make this happen. But education is number one. That's our future. Our children are our future, and I think any investment, if there's any return on investment, then I think any money spent on our children is a money well spent. Thank you.
Thank you, John. Senator Tello, you have 2 minutes starting now.
Thank you, Chris and Sabrina. Improving public education requires decision makers to find out from not just students, but parents and teachers and administrations on what exactly we should fund when it comes to DOE. We need to look at cost-cutting measures like renewable energy to use, to divert some of the funding that we can on cutting back into DOE for school children. I've been an advocate for charter schools. I'm finding out that we're seeing more of our students testing higher that are coming out of charter schools and implementing, and we're only providing them, not very much money compared to what we're giving to the DOE schools, but it's a different story. I'd like to see us transition more students into charter schools to give them that adequate education that we've been talking about for years. You have students who are one-on-one. And, in the climate that we are in today with teaching not face-to-face, but through internet and online teaching, it's definitely put a different perspective in things. And I think that face-to-face is very important for students to have that inner engagement with each other. But in the meantime, using technology to assist DOE is an avenue that we need to take, because we can actually save some funding going through this. Everybody has taken cuts in the government of Guam, public safety, the hospital, public health. Everybody has to, because of our economy. There's nothing we can do about it, but what we can do is find things in the agency that we can save money on. And like I said, energy, technology are all these areas. And to engage the parents as well with the administrators of DOE.
Thank you, Senator. You guys have 2 minutes for your closing statement. We'll go ahead and start with John. You have 2 minutes to close, John.
All right. Again, thank you very much for this opportunity, Chris and Bree, KUAM, The Link. Thank you, Tello, for being here with me. Thank all of you. And thank you, Guam, for listening. Right now, we need to come together, and we need to elect leaders that are going to be consensus builders and work together for everybody on Guam. The divide, this pandemic has caused such a huge divide, and there's definitely some issues where we're losing lives and livelihoods. I am willing to work, and I challenge anybody, if elected, I challenge any of the senators to work along with me and work just as hard as I will work. I'm John Ananich. I'm number 12 on the Democratic side of the ballot, and given the opportunity and your confidence, I'd like to go to work for you, and I'd like to work for the people. So remember me, and I'm not going to humbly ask for one of your votes, because I don't believe that these are humble times. But I'm going to kindly and confidently ask for just one of your votes, number 12 on the Democratic side, and allow me the opportunity to work for you. Because at the end of the day, it doesn't matter Democrat or Republican. If elected in the 36th, what we do forward and where we go forward here on out is going to be, it has to be for the people, and everything has to be for everybody, not just a certain few. So consider me, and I look forward to the opportunity to work for you and represent the people of Guam. Again, I'm John Paris Ogden Ananich, number 12 on the Democratic side of the ballot. Thank you very much.
Thank you. Senator Tydegui.
Thank you to KUAM, the KUAM family, including everybody behind the scenes. I'd like to thank you for this opportunity, and those who are listening this morning. And John, it's a pleasure, always a pleasure to see you and hear what you have to say. I think you would be a good guy. Okay. It's been an honor to serving the community these past year and a half. As your working senator, I will continue to ask the hard questions and fight for transparency and accountability. In this term, I've introduced legislation that begins the difficult but necessary work in building a safe and modern hospital. Legislation that funded security cameras for public safety, and proposals that respond to economic challenges by advocating for a lower BPT and improving government process for new responsible development. And there's so much more work to do, and if I'm elected to serve you in the 36th Guam legislature, I stand committed to working just as hard as I have this term. And I humbly ask for your vote of confidence. I'm Telo Tydegui, number 11 on the Republican side of the ballot. Situsmasi, maraming salamat po. Thank you, Guam, and create a great day.
Thank you, Senator.
All right. Thank
you, John.
Thank you. Thank you, guys.
Stay
Bye,
safe.
guys.
All right,
you
that's
so
that.
much.
Okay.
Yes.
There's a
Adios.
virtual lunch plate for you guys on your way out if you want to grab that. 10:06. Good job, Joe, sir. Good job, Jason Solis, Kengineer, Master Control, most especially to our listeners, viewers, commenters. Here on the link, we did get some pretty interesting comments during these interviews. Bree?
I think thank you for watching, listening, and streaming. Please stay safe. We did have that statement that was released from Adelup. You have it, Chris?
Yeah.
Okay, I got
Okay.
it.
It's basically a long, hard no. I want to read it. Can I read it? You want to do a dramatic reading or regular?
Dramatic.
Just read it.
Okay, fine. Nothing is more important to Governor Leon Guerrero than the health and safety of the people of Guam. That's why she's taken aggressive and sometimes unpopular steps to slow the spread of COVID-19. The governor has been clear that our policies will be directly linked to the data we have. She's especially concerned about the increase in new cases, the increase in hospitalizations, and the increase in COVID-related deaths. For these reasons, she will not be lifting any additional restrictions this week, and the island will remain in PCOR 1 with a safer-at-home advisory. As we work to save lives and livelihoods, we emphasize that mandatory quarantine for incoming travelers, strong contact tracing, and the choices we make individually are the best tools we have to decrease any increase in COVID-19. Please avoid excess travel, wear your masks, social distance, wash your hands. We must protect ourselves, our families, and our community.
And that was the statement as read by Chris Barnett.
Thank you.
From our governor.
Lilian Grill.
Basically, no dine-in. Sorry, guys. Man, I thought for sure that we're just going to flip it all open. Yeah. Bree, takeaways here?
We heard from Lillian Posadas. 44? Did she say 44? Is the COVID census at the Guam Memorial Hospital? I'm trying to find it. Yeah, 44 hospitalized at the Guam Memorial Hospital, 15 receiving ICU level of care, and 7 people are on ventilators.
And Lillian is anticipating the numbers, of course, hospitalizations to increase. As she's often said, about 10 to 20% of the positive cases end up at the Guam Memorial Hospital. So that's definitely something to look out for. 10:09.
The Physicians Advisory Group, Dr. Ho Win, definitely saying they need to step up contact tracing, need to hire more people.
Yes, he also expressed his concern at the high number of positives and also the gathering that's going on and the demographic, 20 to 40 years old. They're trying to figure out a way to get some messaging out to this demo, and we'll keep you posted on that. Again, the show proudly brought to you by Carrier, Calvo Enterprises, and ITE 1010 on the way, your go-to jam on the breeze. My name is Chris.
I'm Sabrina.
Joe, sir, thank you again. You guys, we leave you this one from Nadine Alana. Again, Chris on the link. Adios.
Bye.